He slapped the rookie nurse for saving a Navy SEAL. Then a Navy helicopter landed on the roof. And in Tacoma, Washington, that sound doesn't mean gratitude. It means someone important is bleeding and someone else wants the truth buried. Inside Harborview Medical Center, the air tastes like antiseptic and panic. Fluorescent lights buzz over a gurney rolling too fast, red soaking through tactical gear. The surgeon is trapped on I-5. The monitor is stuttering toward silence. Maya Grant stands there with rookie-clean credentials and battlefield-steady hands, knowing the cruel math-follow protocol, and he dies. Stay to the end, and you'll see how one decision can expose a hidden war inside a civilian hospital. If you're watching from somewhere real right now, comment your city and hit like, because the next sound you hear might be rotors. The rotors kept chewing the air above Harborview heavy and close enough to make the glass doors tremble. Maya Grant stood just outside them with a cardboard box pressed to her ribs, rain stippling her hairline, her cheek still hot where the CEO's hand had landed. The parking lot smelled like wet asphalt and old exhaust. People behind her began to gather, not rushing, just drifting toward the sound, the way bodies drift toward thunder. Someone whispered military. Someone else said, "Why here?" Maya did not turn around. She watched her own breath fog and vanish, and she tried to let the moment pass through her like weather. She told herself she was already gone. Fired. Unwelcome. A solved problem. But that sound did not belong to closure. It belonged to a different kind of attention, the kind that followed you long after you thought you had earned the right to disappear. Inside the lobby, lights flickered once, then steadied. A security guard jogged toward the elevators with his radio pressed to his mouth, words spilling too fast to matter. Visitors stopped mid-step, coffee cups held in midair. A child tugged at his mother's sleeve and asked what was happening, and she did not answer because she did not know which kind of fear to pick. Nurses appeared at the corridor, mouths like deer at a tree line. Eyes wide, hands full, pretending they were headed somewhere important. Maya tightened her grip on the box until the cardboard bit her palms. The sting helped. The sting was simple. She had not started the morning thinking her name would matter to anyone outside a whiteboard assignment. She had clocked in at 6:37 with damp shoes and a thin film of rain on her jacket. Tacoma rain was not dramatic. It was persistent. It got into seams. It made everything smell metallic. She had stopped at the vending machine for bad coffee because the cafeteria line was already backed up and because sleep had become a luxury she could not afford on a rookie schedule. Harborview, Tacoma did not look like the hospitals on recruitment brochures. It looked like function. Scuffed linoleum. Overhead paging that never shut up. Trauma bay. Two missing a working drawer so the gauze lived in a plastic bin. The place ran on competence and exhaustion held together by people who learned to swallow their emotions in 30-second increments. Maya had done her orientation 2 weeks earlier, nodding through policies that sounded tidy in a classroom and messy in real life. The nurse educator had smiled and told them to protect themselves. Chart everything. Follow chain of command. Call the attending. Document the time. Maya had written it all down because she always wrote things down, but her notebook was not a fresh hospital issue pad. It was a battered little thing she kept in the bottom of her bag pages, warped from humidity, and sweat corners darkened by old dirt that never fully washed out. She had not told anyone where the notebook came from. She had learned early that people asked questions when you gave them details. She did not want questions. Questions led to names, and names led to paperwork, and paperwork led to the kind of attention that made your skin crawl. The charge nurse that morning was Denise Parker, a woman with sharp eyes and a voice that cut through noise without ever becoming a shout. Denise did not have time for ego, only for outcomes. She had looked Maya up and down, clocked the too clean badge, the calm posture, and the way she watched the room instead of the people in it. "You freeze, you sink," Denise said, handing her a set of trauma gloves. "You move, you float. Stay close." Maya had nodded. "Yes, ma'am." Denise had smirked at the ma'am. Just Denise. Nobody here is royalty. Maya took her spot. She stalked. She checked suction. She pretended the ordinary was all she needed. Around her, the ER ran its usual rhythm. A teenager with a broken wrist from skateboarding. A man detoxing on a stretcher with a blanket pulled over his head. An elderly woman with chest pain who kept apologizing for being a bother. The kind of day that could be hard and still feel predictable. Then at 7:42, Trauma 1 called overhead. A gurney arrived like a hard truth. It was not the blood that hit Maya first, although there was plenty. It was the way the room changed when the patient rolled in. Not louder, not more frantic, just sharper, as if everyone's peripheral vision tightened. The man on the stretcher was young, late 20s, muscles carved by discipline, not vanity. His face was pale under a layer of sweat. His eyes were open, but distant, fixed on a point above the ceiling tiles, like he was trying to hold on to something that kept slipping. His clothes were not street clothes. Tactical pants, a torn plate carrier, a patch half ripped away. The paramedic leaned in, voice clipped. Gunshot wound left chest. No exit. Pressure's tanking. Denise's eyes flicked to Maya. Pressure here. Now! Maya stepped in and pressed down with steady force, feeling heat soak through gauze. Someone cut away fabric. Someone called for blood. Someone shouted for an ultrasound. The resident on shift, Dr. Arun Patel, looked younger than he should have for this kind of moment, but his hands moved with practiced speed. He gave orders like he was trying to convince himself he belonged in them. Airway, Patel said. Get me vitals. Where's cardio? A tech checked the board. Another nurse stared at her phone, face tightening. Dr. Kessler is stuck on Interstate 5, she said. Pile up, police have it blocked. For half a second, the room held its breath. Maya watched the monitor with the kind of focus that narrowed the world into green lines and numbers. The heart rate was erratic. Oxygen was dropping. The blood pressure reading looked like a slow collapse. She leaned closer, not to be brave, but to listen with her hands. Under her fingers, the wound felt wrong. Not superficial, not a simple channel. There was a vibration there, a subtle, wet resistance, like something in the chest was fighting to stay contained. She had felt that before. Not here, not under clean lights. In a tent where sand got into everything and you learned to make peace with the fact that permission arrived after the body was already cold. Let's intubate. And wait. The attending. Dr. Larkin said, voice firm, safe. We cannot open a chest in this bay. Maya heard him. She respected him. She also saw the clock in her mind counting down in heartbeats, not minutes. The monitor chirped, then dipped again. Ava stepped back. Someone snapped, calling her by the wrong name. Because in trauma, everyone became a role before they became a person. Let the team work. Maya did not step back. She shifted her pressure, mapped the angle, and felt it. The bullet was not wandering. It was lodged, anchored, too close. It kissed the heart with each beat like a threat. If it moves on its own, she said quietly, more to herself than anyone. He's gone. Patel glanced at her, sweat shining at his temple. We do not have clearance for that. Maya's eyes never left the patient. We do not have time. The monitor screamed. The patient's back arched once, then settled. The line flattened, hesitating on the edge of decision. In that instant, Maya felt the whole weight of the hospital's rules pressing down on her shoulders. And beneath that, she felt something older, heavier, more honest. The memory of hands that had trusted her because there was no one else. The memory of waiting for permission and watching it arrive too late. She reached for the tray. Metal clinked. Heads turned. Maya, Patel said, voice cracking. Don't. Maya picked up the scalpel anyway. Her movements were clean. No wasted motion. The incision was fast and precise, the kind of cut that came from muscle memory, not impulse. Blood welled dark and heavy. Gasps rippled through the bay. Someone swore. Someone turned away. Maya opened the chest with hands that did not shake until afterward. She found the bullet exactly where her fingers had predicted it would be, slick and cold against living tissue. She closed her grip and pulled. The monitor stuttered, dipped, then surged back with a hard, unmistakable rhythm. The patient sucked in a ragged breath like he had been dragged up from deep water. For a moment, the room stood frozen between shock and relief. Then the CEO arrived. Charles Reddick did not come in like a medical leader. He came in like a man protecting an asset. Suit immaculate, eyes hard, anger shaped by reputation and risk, not by the sight of a dying kid. "What happened?" he demanded, as if volume could reverse time. A resident spoke too quickly. "The nurse she operated." Reddick's gaze snapped to Maya. "You did what?" Maya met his eyes, blood on her gloves, breath still controlled. "He was dying." "You are a nurse," Reddick said, voice rising. "You do not cut into patients. You do not make surgical decisions." "He would not have lasted 2 more minutes," Maya said. Reddick stepped forward, and before anyone could react, his hand struck her face. It was not a disciplinary tap. It was a slap meant to erase her. "You're fired," he said. "Effective immediately. Turn in your badge." Maya stood still, cheek-burning heartbeat loud in her ears. Not because she was surprised, because some part of her had hoped the world might recognize what she had done before it punished her for it. She removed her badge and placed it gently on the counter. "I saved him," she said, not as a plea, but as a fact. Reddick did not look at the patient. He looked at liability. Maya walked out, and now, outside the doors with rain in the air and her box cutting into her arms, she listened to the helicopter settle onto the roof like a verdict. The lobby behind her thickened with bodies and whispers, the kind that always arrived after the blood was cleaned up. Then, from the stairwell that led to the rooftop, the door slammed open hard enough to make the glass vibrate, and the first set of boots hit the tile with a calm authority that quieted the room in a single breath. Boots hit the tile with a sound that did not belong to nurses or security. It was measured unhurried, as if the person wearing them had never once needed a building's permission to enter it. Heads turned. Conversations died mid-sentence. Even the monitors seemed to quiet their beeps, suddenly small against the weight moving through the lobby. A man stepped out of the stairwell first. Tall, broad-shouldered, silver hair cut close beneath a dark cap. His uniform was pressed in the way only a lifetime of standards could press fabric into obedience. 2 officers followed, eyes scanning corners without obvious motion, hands relaxed, but ready. They moved like they had trained for chaos and learned to walk through it as if it were weather. Maya stood outside the sliding doors with rain spotting her arms, the cardboard box heavy against her chest. She did not need to see the rank on his collar to know what he was. She knew the posture, the stillness, the way the room reorganized around him like iron filings around a magnet. Inside, Denise Parker straightened at the nurse station entrance, mouth set. Dr. Patel froze with a chart in his hands. A visitor with a cane took a step back as if the air had suddenly turned sharp. The man stopped just long enough to take in the lobby, the elevators, the corridor to trauma, the nurses watching from doorways. His gaze was controlled, not curious. He was not here to learn. He was here because he already knew enough. Charles Reddick arrived from the administrative corridor at a speed that did not match his usual polished stride. His tie sat a fraction off center, his jaw tight. He saw the uniforms, and his face rearranged itself into a smile that looked practiced and hollow at the same time. Sir Reddick said, stepping forward with his hands open, palms angled up in a gesture meant to soothe. "Welcome to Harborview Medical Center. I am Charles Reddick, Chief Executive Officer. This is a civilian facility, so if there has been some confusion about landing clearance," the officer did not look at the ceiling. He did not glance toward the roof. He looked at Reddick the way a commander looks at an obstacle that is trying to be a door. "I am Vice Admiral Thomas Caldwell," he said. Voice calm, accent flat, words weighted. "Where is the operator brought in at 0742? Reddick blinked. The phrasing caught him. Operator. Not patient. Not victim. Not man. "Our trauma team has him stabilized," Reddick said quickly. "He is in good hands. We can take this to my office, discuss proper channels." Caldwell did not move. The 2 officers behind him did not move either. They simply existed in the space like a warning. "No," Caldwell said. "Where is he?" Denise took a step forward before Reddick could redirect. It was not defiance. It was triage. Her voice stayed respectful, but her eyes did not soften. "Sir, he is in the ICU," Denise said. "They just transferred him." Caldwell's gaze flicked to Denise. A brief nod. Not gratitude, recognition of competence. Then his eyes returned to Reddick. Take me. Reddick's smile held, but his throat tightened. Of course. This way. As they moved, the lobby parted. People pressed to walls. A volunteer in a red vest clutched a clipboard to her chest and stared as if she had never seen a uniform before. A security guard started to step forward, then caught Caldwell's eyes and stopped. Instinct over policy. Outside, Maya watched through the glass. The slap still pulsed in her cheek with each heartbeat. She shifted the box higher, feeling her notebook scrape against a stethoscope and the hard edge of a photo frame. She told herself she could walk away. She could leave the whole building behind and let their problems remain theirs. But her feet stayed planted. The helicopter rotors above slowed each rotation heavier than the last until the sound settled into a low, mechanical growl. The rain kept falling as if nothing unusual was happening, as if this were any other morning in Tacoma. Reddick led Caldwell toward the elevator bank that connected to the ICU floors. As they passed the trauma corridor, Dr. Larkin appeared, hands still damp from scrubbing, eyes wary. He tried to hold his posture steady, but the tension in his neck told the truth. Vice Admiral Dr. Larkin said, and his voice carried the subtle strain of someone suddenly aware of optics. I am Dr. Larkin, attending physician in emergency medicine. Your nephew. Caldwell's gaze snapped to him. Alive. Yes, Larkin said, catching his breath. For now, we are monitoring him closely. Caldwell held the doctor's eyes for a long second. How? Larkin hesitated. It was a small pause, but it stretched in the air like wire. Reddick stepped in. Our team acted quickly under pressure, he said, as if that ended the question. We followed hospital protocol. The patient's condition has been stabilized. Caldwell's eyes did not leave Larkin. I asked how. Denise watched from the corridor, mouth-lips pressed together. Patel shifted his weight from one foot to the other and looked down at the floor like it might open up and swallow him. Maya saw the pause through glass and distance. She recognized it. The moment when everyone decides whether truth is worth the trouble. The elevator doors opened with a soft chime. Caldwell stepped inside. His officers followed. Reddick moved in last, still talking. Our ICU is secure, he said. You are welcome to meet the care team. We can address any concerns you have about procedure. The doors slid shut. Maya stared at her reflection in the glass for a moment. Rain streaked her hair. Blood had dried beneath one fingernail. Her cheek was faintly swollen. She looked like someone who had lost a fight, not someone who had saved a life. Behind her, the automatic doors hissed open and closed as people filtered out and in. No one touched her. No one apologized. Their eyes glanced off her like she was a hazard sign. Maya turned finally and walked back inside. Not toward the trauma bay. Not toward administration. She drifted along the lobby wall with the box in her arms, a shadow trying to stay unnoticed in bright light. Denise saw her and took a step as if to speak, then stopped. Her face showed conflict, anger, something like shame. She did not say anything. She only held Maya's gaze for a beat long enough for Maya to understand she was not invisible to everyone. On the elevator, Reddick adjusted his tie in the mirrored wall. Caldwell watched the changing floor numbers without blinking. You mentioned a surgeon, Caldwell said, voice steady. Reddick cleared his throat. Our cardiothoracic surgeon was delayed in traffic. Interstate incident. But we managed the situation until he arrived. Caldwell's eyes turned slightly. He arrived. Reddick hesitated again. He is en route. Caldwell looked away as if the answer had already been filed under unacceptable. When the elevator doors opened onto the ICU floor, the air changed. The chaos of the emergency department fell away. Here, everything was controlled, quiet, tense, in the way quiet can be when it is built from fear of breaking something fragile. Nurses moved with careful speed. Voices stayed low. 2 uniformed guards stood outside one room, hands near their belts, not hospital security but military. Their eyes checked Caldwell, then snapped to attention without needing instruction. Reddick stopped short. I was not informed there would be armed personnel in the unit. Caldwell did not slow. You were not informed of many things this morning. A nurse approached, pale but professional. She wore a badge that read Kim, and her hands shook slightly as she held a tablet. Vice Admiral Caldwell, she said. Lieutenant Caldwell is stable, sedated. Vitals are holding. Caldwell's chest rose and fell once slow. Let me see him. Kim led them to the room. Through the glass, a young man lay against white sheets, chest-wrapped machines breathing and counting for him. His face was bruised at the temple. His hands were calloused. There was a stillness to him, even in sleep, as if his body did not know how to fully stand down. Caldwell stood at the glass and stared. For a moment, the rigid lines of command softened into something almost human. Reddick leaned forward, still trying to own the narrative. As you can see, he is alive and in excellent care. We will provide full documentation to your office. I assure you, the hospital handled this with the highest standards. Caldwell turned his head slightly. Handled it. His voice did not rise, but the temperature in it dropped. Yes, Reddick said too quickly. Our team handled it. Caldwell's eyes returned to the glass. The bullet was close to his heart. Kim's throat bobbed. Yes, sir. A near miss, Caldwell said, and it did not sound like relief. It sounded like calculation. Reddick forced a small laugh. These things happen quickly. We are fortunate we have talented staff. Caldwell finally looked at him. The stare was direct enough to feel like pressure. Explain the sequence, Caldwell said. Minute by minute. Reddick blinked. I am not clinical. The attending can provide. Caldwell's gaze cut to Kim. You. Kim swallowed. Her eyes flicked to Reddick, then back to Caldwell. Her voice was quiet. Lieutenant Caldwell arrived with a chest gunshot wound. No exit. Blood pressure dropping. The surgeon was delayed. The team attempted stabilization. Caldwell waited. He did not interrupt. The silence made people talk. Kim's eyes flicked again, and this time the hesitation was heavier. And then Caldwell said, Kim's fingers tightened around the tablet. A nurse performed an emergency thoracotomy. The corridor seemed to narrow. Reddick's head snapped toward Kim. That is not the official statement. Caldwell did not look at Reddick. Name. Kim inhaled. Maya Grant. The name landed in the ICU like a dropped instrument. Caldwell's expression changed. Not surprise, something sharper. Certainty. The kind that comes when a missing piece clicks into place. Reddick stepped forward, voice urgent. Sir, she has been terminated. She acted without authorization. It was gross misconduct. She endangered the patient and exposed this hospital to tremendous liability. Caldwell's eyes stayed on the sleeping man behind the glass. My nephew is breathing. Reddick's mouth opened, then closed. That is not the point, Reddick said, and he sounded like a man trying to convince himself. Caldwell turned slowly, and when he looked at Reddick, the room felt smaller. That is the only point, Caldwell said. Kim stood frozen. Larkin shifted in the hallway, face tense. Patel hovered behind them, trying to disappear into the wall. Caldwell leaned in slightly, voice still calm, every word clean. Where is she? Reddick straightened as if he could regain control with posture. She is no longer employed here. Security has been instructed to escort her off the premises. Caldwell's gaze did not blink. Bring her to me. Reddick's eyes widened a fraction. Sir, with respect, she is not authorized to be in this unit. Caldwell held his stare. Then he spoke softly enough that it did not sound like a threat, but it carried the weight of one. With respect, Caldwell said, you struck and fired the person who saved my nephew's life. You did that without knowing who she was. Reddick's face went pale, and for the first time, his corporate mask cracked. I did not know she had any connection to you. Caldwell's eyes hardened. Connection did not save him. Competence did. He turned slightly toward Kim. Is she still in the building? Kim hesitated, then nodded. She was in the lobby a moment ago. She was carrying her things. Caldwell's eyes moved past the glass, past the ICU doors, as if he could see through floors and walls. His voice lowered almost to himself. Maya Grant, he said again, and this time it sounded like memory. Reddick forced his smile back into place, trembling at the edges. Sir, if there has been a misunderstanding, we can address it formally. The hospital will cooperate fully. But she violated regulations. There are standards. Caldwell took one slow breath, then turned away from the glass. Take me to her, he said. They moved down the corridor. The two officers shifted into a protective formation without being told. Nurses stepped aside. Conversations died. The ICU doors opened and closed behind them like held breaths released. In the elevator, ride-down Reddick spoke in short bursts, trying to reclaim narrative through volume. She cut into a patient without a surgeon present, he said. If something went wrong, if he died, the hospital would face lawsuits, sanctions, possible closure. The board would hold me responsible. You have to understand the position I am in. Caldwell stared at the floor numbers as they dropped. I understand positions. When the doors opened to the lobby, the rain light outside had shifted darker, and the building still held the residual vibration of the helicopter landing. Staff lingered in clusters that pretended to be busy. Security stood near the entrance radios, clipped to their shoulders, eyes darting between Caldwell and Reddick. Maya stood near the wall, with her box not sitting, not pacing, simply waiting in the only way she knew. Her posture was straight. Her face was composed. The swelling on her cheek was visible now that the adrenaline had drained. Caldwell's eyes found her immediately. Everything else blurred. He walked toward her without hesitation. His officers stopped a few paces back, giving him space, watching the room. Maya felt the weight of his attention before he spoke. It pressed against her skin like heat. She lifted her chin, not defiant, not submissive, simply present. Caldwell stopped in front of her and studied her for a long beat. Not just her face, but the way she held herself. The steady stance, the calm hands, the eyes that had seen too much to be impressed by uniforms. Reddick stepped in, voice tight. Vice Admiral, this is the nurse. She has been terminated and is being escorted out. Caldwell did not look at him. He looked at Maya and spoke her name like a lock turning. Maya Grant. Maya's throat tightened. She did not know why it still affected her hearing it said that way, with that particular gravity. Yes, she said. Caldwell's eyes did not move. How is my nephew? The lobby went silent as if the building itself had stopped to listen. Maya did not flinch at the word nephew, but something in her chest tightened as if the air had thickened. He's alive, she said. Stable last time I saw him. Caldwell's eyes held hers, searching for cracks. He did not find any. He nodded once, slow, like a man allowing himself one breath. Behind him, the lobby was still. Phones stopped scrolling. A coffee cup hovered half-lifted. Even Reddick's security team looked unsure which direction authority flowed. Reddick recovered first, pushing his voice into the silence, the way a man pushes paperwork across a desk. Sir, we have the situation under control, he said. As she stated, the patient is stable. There is no need for further disruption. We can continue this discussion privately. Caldwell did not look at him. Who saved him? Caldwell asked Maya. The question was simple. The room understood it was not. Maya's throat moved. Her cheek still throbbed, each pulse a reminder of exactly how the hospital had chosen to answer that same question a few minutes earlier. I did, she said. A murmur rolled through the lobby, not loud, but alive. Someone near the elevators whispered. She admitted it. Someone else sucked in a breath, like confession had a sound. Reddick stepped forward sharply. You are not authorized to speak on behalf of this facility. Maya turned her eyes to him for the first time since the slap. She did not glare. She did not plead. I'm not speaking for your facility, she said. I'm answering his question. Caldwell's gaze shifted finally to Reddick. The temperature in the room seemed to drop. You struck her, Caldwell said. Reddick's smile twitched. Sir, emotions were high. She performed an invasive procedure without clearance. We have regulations. If a patient dies because someone bypassed protocol, there are consequences. Caldwell's voice stayed even. My nephew was dying, and he is alive, Reddick insisted, as if that fact supported him. But that does not make her actions acceptable. We cannot have staff making unilateral surgical decisions. Denise Parker stepped closer from the corridor, her expression locked down. She looked like she wanted to say 10 things, and was choosing the one that would matter. Sir, Denise said to Caldwell, the surgeon was delayed. We were losing him. She did what she did because there was no time. Reddick snapped his head toward Denise. You will not undermine administration in front of a federal officer. Denise held his stare. You already did that yourself. A few people exhaled too loudly the way you do when someone says the quiet part out loud. Caldwell lifted a hand, and the movement was small, but it shut the room down. Maya Grant, he said, returning to her. You opened his chest. Maya shifted the box higher against her ribs. Her hands felt raw. Blood had dried under her nails. The cardboard edge pressed into the bruise blooming across her forearm. Yes, she said. You removed the round. Yes. You did it without authorization. Yes. Reddick seized the rhythm, stepping into it like a lawyer into a deposition. Sir, this is exactly what I am saying. She just admitted to gross misconduct. The hospital cannot condone that behavior. We have an obligation to the board, to our accrediting bodies, to every patient in this building. Caldwell's eyes never left Maya. If you had not acted, he asked her would he be alive. Maya did not hesitate. No. Caldwell nodded as if he had already written the answer down somewhere inside himself. Then he turned to Reddick. You are going to reinstate her, Caldwell said, immediately. The lobby seemed to inhale. Reddick blinked once, twice, as if the words had not translated into his reality. Sir, I do not believe you understand. This is a civilian hospital. Employment decisions are not within military jurisdiction. Caldwell's voice remained calm, but it gained weight. You are treating an active-duty naval special warfare operator in your facility. Your staff assaulted the clinician who saved him. Those are not simple employment decisions. Reddick's face flushed. She is not a clinician. She is a nurse. There are scopes of practice. There are laws. Maya watched Reddick's mouth form the word laws like it was a shield. She felt a familiar bitterness rise and then settle. She had heard men use the right words to justify the wrong choices before. Caldwell took a step closer to Reddick. He did not crowd him. He did not raise his voice. His authority did the crowding for him. You are going to apologize, Caldwell said, and you are going to reverse your decision. Reddick's gaze flicked around the lobby searching for an ally. He found none. His own security staff stared straight ahead. The visitors looked away. Denise did not move. Dr. Patel, standing near the corridor, looked like he might faint. Reddick swallowed. Sir, even if I wanted to, it is not that simple. There would be an investigation. She would face licensing review. The hospital would face litigation. We cannot risk. Maya's voice cut through his sentence. Stop, she said. Every head turned to her. Reddick stared as if she had just spoken out of turn in court. Caldwell did not interrupt her. He waited. Maya looked at Caldwell, then at the crowd, then back at Caldwell. Her cheeks still burned, but the heat had shifted, turning into something steadier. I'm not interested in being rehired because someone important arrived, she said. I'm not a problem you solve with a signature. Reddick's mouth opened. You are refusing reinstatement. Maya's eyes flicked to him. I'm refusing your version of it. Caldwell studied her the way a man studies a landscape he recognizes even after years away. You would walk away, he said, not accusing, not admiring, just measuring. Maya nodded once. I already did what mattered. The lobby held its breath again. This time, not from fear, but from the strange tension of watching someone refuse power when power was being offered. Reddick found his voice sharp with relief that she had just handed him a legal exit. There, he said quickly to Caldwell. She is declining. This matter is concluded. Caldwell's gaze did not leave Maya. No, Caldwell said. Reddick blinked. Sir. Caldwell's eyes narrowed slightly. You do not conclude anything. He turned fully toward Maya, lowering his voice so the room had to lean in to hear even if they pretended not to. Do you remember algebra? Caldwell asked. Maya felt the lobby tilt. Not physically, but inside her. The hospital smell faded, replaced by grit and diesel and sun-baked canvas. Her fingers tightened around the box. Yes, she said carefully. Reddick's brow furrowed. What is this? Caldwell did not acknowledge him. Do you remember the triage tent? Caldwell continued, the one that shook when the helicopters came in low. Maya's jaw tightened. She could see it clear as if it were painted on the lobby wall. The red dust. The screaming metal of rotor wash. The bodies arriving faster than hands could keep up. Yes, she said again. You were there, Caldwell said. You worked on my unit. Denise's eyes flicked to Maya, surprise flashing across her face before she crushed it back into professionalism. Patel's head snapped up. Larkin's posture stiffened. Maya looked past Caldwell for a moment at the glass doors where rain streaked down like static. Her throat felt tight. "That was a long time ago," she said. "It was not long enough," Caldwell replied. Reddick stepped forward again, frustration cracking his control. "This is irrelevant. If she has military experience, that makes her decision even more egregious. She should know the importance of chain of command." Maya turned her head slowly toward him. "In places like that," she said quietly, "chain of command is a luxury. You do not always get permission. You get seconds." Reddick's face tightened. "This is not a war zone." Maya held his gaze. "No, it's worse in some ways. Here you can pretend time is negotiable." Caldwell lifted a hand again, and Reddick's words died. "You disappeared," Caldwell said to Maya. Maya's eyes returned to him, cautious now. That word again. Disappeared. As if she had stepped out for coffee and never came back. "There were no records," Caldwell continued. "No follow-up. One day you were there, and the next, your name was gone." Maya's chest tightened. She could feel the old anger trying to rise, the kind that tastes like metal. "I did not vanish," she said. "I was reassigned." "By whom?" Caldwell asked. Maya's fingers flexed on the box edge. She could have said the truth the way it lived in her memory, sharp and ugly. Men in clean uniforms. A conversation behind a tent flap. A handshake that felt like a trap. A folder that closed with her life inside it. Instead, she said, "by people who did not ask my permission." Caldwell's expression shifted, something like understanding, cutting through the command face. "And now you are here," he said, "cutting a bullet out of a chest the way you did back then." Maya's voice stayed steady. "I'm a nurse in Tacoma." "That's it." Caldwell watched her for a long moment, as if deciding how much pressure to apply and where. Then he nodded once. Reddick tried again, desperation seeping through his professionalism. "Vice Admiral Caldwell, even if you believe she acted with good intentions, the hospital must protect patients. We cannot allow unlicensed surgical intervention. If we tolerate that, we open ourselves to catastrophe." She could have killed him. Maya's eyes flicked to Caldwell. "I could have," she said. The admission was quiet, honest. Denise's breath hitched. Patel's face tightened. Some people in the lobby looked away, unable to watch truth sit that plainly on the floor. Maya continued. "But I also knew he was going to die if I waited." Caldwell's gaze did not waver. "You did what you believed was necessary." "Yes," Maya said. "And it cost me my job. That part is fair." The slap was not. A few people flinched. Not because they disagreed, but because she had said it in front of everyone. Reddick's ears reddened. "I did not assault her. I disciplined an employee." Denise's voice was sharp. "You hit her." Reddick swung his eyes toward Denise, fury rising. "Enough." Caldwell's voice cut through them both. "You will not speak to your staff that way," he said to Reddick. "Not now." Reddick swallowed hard, then tried to pivot to safer ground. "Sir, your nephew is stable. You should be with him. We can handle internal matters." Caldwell's eyes stayed cold. "Internal matters stopped being internal when my nephew was placed in your care." Maya shifted her weight. Her box creaked softly. Caldwell turned back to her. "You said he is stable." "For now." Maya nodded. "That is what the monitor showed when I left." Caldwell's gaze sharpened at the phrase "monitor" showed, as if it hinted at details he cared about. "Walk with me," he said. Maya did not move immediately. Reddick jumped in. "Sir, she is no longer an employee. She is not cleared for patient areas." Caldwell looked at him. "She saved him. That is clearance enough." Maya's jaw tightened. "I'm not your staff," she said to Caldwell. "And I'm not a mascot you bring upstairs to make a point." Caldwell's expression did not change, but his voice softened by a fraction. "I am not asking you to make a point," he said. "I am asking you to answer questions accurately, the kind that decide whether people get hurt again." Maya felt something shift in her gut. Not fear, not excitement. A quiet alertness, the same one that used to wake her before alarms did. Denise watched, her eyes steady. It was not permission. It was support. Maya looked down at her box, then back up. "All right," she said. They moved toward the elevators. Caldwell's officers flanked them, forming a perimeter without making it obvious. The lobby parted again. People pretended to be busy, but their eyes followed. Reddick hurried alongside, voice tense. "This is inappropriate. This exposes the hospital to further liability. I will be contacting legal counsel immediately." Caldwell did not respond. Inside the elevator, the air felt too close. Maya could smell starch on Caldwell's uniform, disinfectant on her own sleeves, and the faint copper trace that followed trauma work no matter how many times you washed your hands. Caldwell stared at the floor numbers as they rose. "What did you see in that wound?" he asked. Maya answered without drama. "No exit." The blood was disappearing into the chest. The heart rhythm was unstable. It was not a bleed you can hold with gauze. Caldwell's eyes flicked to her hands. "You located the round by touch." "Yes." Reddick snorted quietly, anecdotal. Maya did not look at him. "It was lodged near the heart. It was tapping it. The patient was minutes from arrest." Caldwell's voice stayed even. "You said the surgeon was delayed." "Yes," Maya said. "Interstate 5 was blocked." Reddick cut in sharp. "Which is why we should have waited for proper surgical care." Maya's eyes finally turned to him. They were tired, not angry. "Waiting was your plan," she said. It was not his. The elevator reached the ICU floor. The doors opened onto quieter light and hushed movement. Nurses glanced up, startled to see uniforms and the CEO and the fired rookie nurse all stepping out together. Kim, the ICU nurse from earlier, stood near the desk with a tablet held tight to her chest. Her eyes widened when she saw Maya. Caldwell's gaze went straight to the glassed room where Lieutenant Ryan Caldwell lay sedated. The machines continued their steady counting. Caldwell stopped at the desk, voice controlled. "I want every record from the moment he arrived," he said. "Vitals, timeline, imaging." Kim nodded quickly. "Yes, sir. We have the scans ready." She lifted the tablet, the screen glowing with grayscale anatomy, and the room leaned closer without meaning to. Kim lifted the tablet higher, the screen throwing a pale wash across her face. Gray ribs, gray lung, a gray shadow where metal had kissed flesh. The room leaned closer without anyone deciding to. Even Reddick stopped talking because images did not care about titles. Maya stepped in beside Kim, close enough to see the fine grain of the scan, close enough to smell the latex and the hospital soap on Kim's hands. "Here," Kim said, tapping with a trembling finger. "Entry is just left of the sternum. No exit. The round lodged here anterior to the pericardium." Caldwell's eyes narrowed. He did not blink. Maya watched the way he studied the image like he was reading terrain. Dr. Larkin cleared his throat softly, trying to reclaim control with vocabulary. "We suspected a near cardiac injury, but without the surgeon present, we stabilized, then transferred." Maya heard the word stabilized and felt her jaw tighten. Stabilized was what people said when they wanted the story to sound clean. Caldwell's gaze moved from the scan to Maya. "You found it by touch?" "Yes," Maya said. "The bleeding pattern was wrong. It was filling a space it should not." Reddick exhaled sharply, the sound of a man allergic to nuance. "We have this documented." The nurse acted outside scope. "The hospital is already reviewing incident reporting." Kim's finger hovered over another slice of the scan. She looked like she wanted to speak, and also like she feared what speaking would do. Caldwell's voice stayed calm. "Continue." Kim swallowed. "The angle is what concerned radiology." Maya's attention sharpened. Angle was not a word nurses used casually. It was the kind of word that came after someone had stared at an image and felt their stomach drop. Kim tapped again. "This is the trajectory." The round did not travel straight. It came in low and slightly lateral, then stopped right where it could destabilize him, but not immediately destroy the heart. Dr. Patel stepped closer, eyes fixed on the screen. "That is what we saw too. It is precise." Reddick turned toward Patel so fast it looked like a flinch. "Doctor, do not speculate in front of federal officials." Patel's mouth opened, then closed. The words stayed trapped behind his teeth. Maya stared at the scan until the anatomy stopped being abstract and became a memory. She could picture the moment in the bay, the wet resistance under her fingers, the way the heart had felt like a trapped animal pushing against a fence. She looked at Kim. Radiology thinks it was intentional. Kim's lips parted. They said the shooter knew where to aim. The ICU seemed to get smaller. The soft hiss of a ventilator became louder, like the building itself was breathing differently. Caldwell's jaw tightened. He did not react with surprise, only with a quiet, contained anger that sat deep and heavy. "You mean they wanted him to make it here?" Maya said. Kim nodded once. Reddick scoffed a thin, brittle sound. "Or it is simply luck. People are shot every day. You are turning this into something it is not." Maya turned her eyes to him. "Luck does not draw a line like that." Dr. Larkin rubbed a hand over the back of his neck. "It could still be coincidence. Ballistics can be unpredictable." Maya kept her voice low because the ICU did not allow shouting without consequence. Unpredictable means messy. This is not messy. Caldwell's gaze moved back to the glassed room where Ryan lay. Tubes monitors numbers that pretended to be comfort. A young man built for water and darkness and speed, now motionless under fluorescent light. Caldwell spoke without looking at anyone. "Who else has seen these images?" Kim hesitated, then answered honestly. "Radiology. Me. The attending. The resident. Nurse Parker was told the surgeon was delayed, but she has not seen the scan." Reddick stepped forward, hands spreading again, corporate and controlled. "Sir, this is exactly why we need to handle this carefully. Any suggestion of targeted violence creates panic. It affects operations. It affects public trust. We should keep this internal until we have something confirmed." Caldwell finally looked at him. The stare was not loud, but it made the air feel thin. "You want to keep it internal," Caldwell said. "Because it is inconvenient." Reddick's face tightened. "Because it is responsible." Maya watched Caldwell's expression stay steady, and she realized Reddick was still thinking like a man fighting lawsuits. Caldwell was thinking like a man fighting enemies. Caldwell turned back to Kim. "I want the original files, not screenshots, not summaries." Kim nodded quickly. "Yes, sir." Caldwell's eyes shifted to Patel. "You're charting from arrival." Patel straightened, grateful for a task. "Yes, sir. It is all time-stamped." Reddick cut in. "Vice Admiral, you cannot requisition medical records without consent and legal process. This is a HIPAA-governed facility. You are putting us in a position." Caldwell's voice stayed calm. "My nephew is active duty. You are providing care under conditions that involve operational security. I am not here to violate law. I am here to stop harm." Reddick opened his mouth, then closed it. He looked as if he had just realized some arguments did not work on people who lived in different worlds. Maya stepped closer to the glass. She could see Ryan's face in profile lashes resting against bruised skin. His chest rose and fell, not fully his own. There was a softness to him now that she had not seen in the bay, where pain had forced him into a clenched kind of courage. Caldwell walked to the door of the room. Kim keyed in, then held it open. Caldwell stepped inside without hesitation. Maya did not follow. She stayed behind the glass, as if distance could keep her from becoming part of someone else's family drama. Inside the room, Caldwell stood by the bed and watched his nephew breathe. His shoulders did something subtle, a fraction of weight leaving them. He reached out and rested 2 fingers on Ryan's forearm, careful not to disturb lines. The gesture was small, but it carried years. Reddick lingered at the threshold, hovering like a man afraid to enter a space where he could not control the narrative. Caldwell spoke quietly, words meant for the sleeping man. "You picked a hell of a week to prove you are stubborn." The monitor continued its steady rhythm. Maya looked away, letting herself focus on the details that did not hurt. The tape holding down an IV line, the slight fog inside a condensation tube, the way Kim's shoes squeaked faintly on the waxed floor as she shifted her weight. Then Caldwell turned his head and his eyes met Maya's through the glass. He held the look for a long moment, not pleading, not demanding, simply acknowledging that she existed in the story, whether she wanted to or not. Kim stepped closer to Maya. Her voice dropped. "He asked for you by name earlier." Maya's stomach tightened. "He is sedated." Before we sedated him, Kim corrected. He was in and out. He asked who did it. The chest. He kept saying he felt hands. He said, "Who is the medic?" Maya stared at her reflection in the glass layered over Ryan's sleeping face. The word medic hit her like a smell from another life. She shook her head once. "I'm not his medic." Kim's eyes softened. Maybe not on paper. Reddick's lawyer arrived then as if summoned by the scent of risk. A man in a fitted suit with a leather portfolio and an expression that said he had never once seen blood outside a steakhouse. He approached Reddick and spoke in a low voice, but the hallway was quiet enough that the tone carried. "Charles, we need to speak," the lawyer said. Reddick nodded sharply and stepped aside, anger simmering in his eyes. "This is out of control." The lawyer glanced toward Caldwell's officers, then toward Maya, then away quickly like looking at her might make him liable. "We need to secure statements," the lawyer continued. "We need to limit access. We need to keep military personnel from dictating hospital operations." Reddick's mouth tightened. "He is already doing it." Maya listened without moving. She had learned long ago that powerful people revealed themselves best when they thought the vulnerable had stopped being relevant. Caldwell stepped back out of the room. The softness in his face was gone again, replaced by the calm of command. He walked toward the desk where the scan still glowed on the tablet. "Ms. Grant," he said. Maya's eyes flicked to his collar, then back to his face. She did not like the title. It made her feel like a civilian being addressed by someone who expected obedience. She kept her voice neutral. "Sir, you said the bleeding pattern was wrong," Caldwell said. "Explain." Maya inhaled slowly, choosing words that would not sound like a confession. If the wound were shallow, blood would pool and spill. It would be visible. This was disappearing. It was collecting inside. The heart rhythm was unstable, and the pressure was falling fast. It felt like the round was resting where it could irritate the heart with every beat. Caldwell nodded. "You were right." Reddick stepped forward again, unable to tolerate the affirmation. "That does not make it acceptable." Caldwell's gaze cut to him. "Stop repeating that." Reddick's face flushed. "I have a duty to every patient in this building." Caldwell's tone sharpened slightly. "Then treat your staff like humans." The lawyer cleared his throat. "Vice Admiral, I represent Harborview Medical Center. There are procedures for information sharing. There are boundaries." Caldwell looked at him, and it was like watching a tide meet a sandcastle. "You arrived quickly," Caldwell said. The lawyer's smile tightened. "We respond to crises." Caldwell's eyes moved past him to Reddick. "Your first response to crisis was to strike the person who solved it." Reddick stiffened. "I disciplined an employee." Denise's voice came from behind them, quiet, but sharp enough to cut. "You hit her." Reddick swung his head toward Denise. "Enough." Caldwell's officers shifted subtly, a warning without words. Reddick's mouth closed. Caldwell turned back to Maya. "You refused reinstatement." Maya kept her shoulders square. "I refuse to pretend a slap is erased by a uniform." Caldwell studied her. "You do not want protection." "I want distance," Maya said. Caldwell's eyes narrowed. "Distance did not keep you out of this." Maya felt irritation flare, then settle. "I did not ask for this." Caldwell's voice lowered the way it had in the elevator. "Neither did my nephew." The words landed heavier than rank. Maya exhaled slowly. "Then focus on him." "I did my part." Caldwell's gaze held hers. "Your part is not done if this was a message." Reddick lifted both hands as if trying to catch the phrase message before it fell into the wrong ears. "We do not know that." Maya looked at the scan again. "Someone aimed to keep him alive." Dr. Larkin shifted, uncomfortable. "Or the shooter is simply skilled and the outcome was not intentional." Maya answered without heat. "Skilled shooters do not miss what they want to hit. They place what they want to place." The hallway grew quiet again. Even the lawyer stopped flipping through his portfolio. Caldwell turned slightly, speaking to one of his officers. "Secure the files. Establish a chain of custody on anything removed from his body. Include the round." Kim's eyes widened. "The bullet is in evidence packaging in the trauma bay." Reddick snapped, "That bullet is hospital property as part of a medical incident record." Caldwell's officer did not look at Reddick. "Yes, sir," he said to Caldwell, and stepped away. Reddick's voice rose a notch. You cannot simply take evidence from a civilian facility. Caldwell looked at him again. Your facility treated it like a liability issue. I treat it like an operational threat. Maya felt the old alertness deepen, the same feeling she used to get when radios went quiet at the wrong time. Caldwell took a step toward the scan, then toward Maya. His voice lowered, not secretive, but careful. This is not only about him, Caldwell said. Maya's eyes narrowed. Then why was he brought here? Caldwell held her gaze. Because someone wanted him in a place where rules slow people down. Maya's fingers tightened around the edge of her box. She had not put it down. She did not trust the building enough to release her grip. Reddick's lawyer stepped closer, trying to wedge himself between command and nurse. Vice Admiral, if you continue making assertions of targeted violence, we will have to notify law enforcement and public safety agencies. That triggers protocols that can shut down this hospital. Caldwell's voice was flat. Notify them. Reddick's head snapped toward the lawyer. Do not! Denise's eyes flicked to Reddick. Charles, if there is a threat, patients are already at risk. Reddick's face tightened, and for a moment, Maya saw the fear underneath the arrogance. Not fear for patients, fear of headlines. Caldwell stepped back, recalibrating the room. I will speak with your administration after my nephew is secured and evidence is secured. Reddick's jaw clenched. He is secured. Caldwell's eyes sharpened. He is sedated and surrounded by glass. That is not security. Kim swallowed. We have guards outside the room. Who placed them? Caldwell asked. Kim hesitated. Military liaison called ahead. Caldwell nodded once as if confirming a detail in a larger pattern. He turned to Maya again. You recognized the placement, Caldwell said. That tells me you have seen this before. Maya held still. The air felt suddenly thinner. I have seen people send messages with bullets, she said carefully. Caldwell watched her face. Where? Maya's throat tightened. She chose a half-truth. Overseas. Reddick scoffed again, weaker this time. This is a hospital in Washington state. Maya looked at him. So was the one in Kabul before it stopped being a hospital. The words came out before she could soften them. The hallway went quiet in the way it does when someone says a name that carries weight. Caldwell's eyes did not leave her. You did not disappear by accident, he said. Maya's fingers flexed against the cardboard until it creaked. I did not come here to talk about that. Caldwell nodded slightly, accepting the boundary for the moment. He turned to Kim. I want his room monitored. No visitors without confirmation. No changes to medication without 2 signatures. Kim nodded quickly. Yes, sir. Reddick bristled. You are issuing orders to my staff, Caldwell answered without looking at him. Your staff are doing their jobs. You are obstructing them. Reddick's face flushed deeper. I am protecting this institution. Denise's voice was quiet. You are protecting yourself. Reddick stared at her, and for a second, Maya thought he might snap again, another slap, another show of power. But Caldwell's officers were there still and watchful. Reddick swallowed the impulse, and it tasted bitter. Caldwell turned back to Maya. I want your statement detailed time-stamped. Maya's eyes narrowed. For a record. For accuracy, Caldwell said. Accurate stories keep people alive. Maya glanced at Ryan through the glass. His chest rose and fell steady. She felt the familiar pull between leaving and staying, between getting out clean and getting pulled into something that did not let go. She said, fine. Caldwell nodded once, then shifted his attention down the corridor, as if listening for something beyond the ICU's controlled quiet. The hospital around them kept working, but the air had changed. People walked slower. Nurses checked doors twice. The guards outside Ryan's room stood a little straighter. The quiet was no longer just clinical. It was watchful. Kim held the tablet close, as if the scan might vanish if she loosened her grip. Reddick's lawyer murmured into his phone, voice tight, stepping away as if distance could make the conversation safer. Maya stayed near the glass and tried to keep her breathing even. The bruise on her cheek throbbed in time with the monitor's steady rhythm. For the first time since the Bay, she noticed her hands were shaking, not from fear, but from delayed adrenaline, finally finding room. A soft alarm chimed somewhere down the ICU hall, different from the steady beeps, higher and urgent. A nurse rounded the corner, fast, face-pale eyes, searching for someone in charge. The nurse who came around the corner moved like she had forgotten how to walk slowly. Her badge swung against her scrubs. Her eyes were wide and unfocused, as if she had seen something that did not fit inside an ICU. "Bed 12, she said, breath hitching. He just dropped. He was talking, and then he could not breathe. Kim lifted her head, already moving. "Call a rapid. Get respiratory." Caldwell's officers shifted, automatically scanning the hall as if collapse could be an ambush. Reddick's lawyer paused mid-sentence on his phone, then stepped away from the noise like fear was contagious. Maya did not ask for permission. Her body made the choice before her mouth did. She moved past Kim, past the desk, her shoes quiet on the waxed floor. Denise fell in behind her without a word. Dr. Patel followed, clutching his stethoscope like it was a lifeline. Dr. Larkin hesitated for half a beat, then came to, pulled by instinct and obligation. Caldwell matched Maya's pace. He did not hurry, but he did not fall behind either. Reddick followed with the stiffness of a man who hated not being in front. Bed 12 was 2 doors down a glass front room with a curtain half drawn. A monitor above the bed screamed high and sharp. The sound was wrong for an ICU. Too loud, too raw. Inside, an older man lay tangled in sheets, eyes wide mouth, open chest, heaving like a bellows that could not pull air. His skin had gone gray at the temples. Around his lips, a darkening blue crept in, subtle at first, then undeniable. A nurse was already at the head of the bed, trying to fit an oxygen mask over his face. Another nurse fumbled with a blood pressure cuff that would not read. "Sir," the nurse at the head said, voice trembling. "Slow, you're breathing. I need you to look at me." The patient tried. His gaze locked on her for half a second, then slid away as if his brain could not keep hold of focus. His hands clawed at the blanket, then at the air, fingers shaking. Maya stepped in and placed 2 fingers on his carotid, feeling the pulse hammering too fast. She leaned close enough to see his pupils. They were slightly constricted, not pinpoint, but not normal either. His sweat was cold and slick. "Any history?" Maya asked, voice low. The nurse answered quickly. "Admitted for pneumonia 3 days ago. Improving. He was stable all morning. He asked for water, and then he started coughing. Then this." Maya listened. The breath sounds were not what she expected. Not the wet crackle of fluid, not the wheeze of tight airways. It was a harsh, uneven effort, like the body had forgotten the rhythm of breathing. Dr. Patel stepped forward. "Could be a pulmonary embolism." Maya shook her head once. "His skin is changing too fast." Denise's eyes flicked to the IV pole. "What meds is he on?" The nurse rattled them off, eyes darting to the chart. "Antibiotics, pain control, a mild sedative last night. Nothing that should do this." Caldwell stood behind Maya, taking in the room with a soldier's attention. The vents above the bed, the door, the staff. The patient's hands, the way they trembled like a signal. Maya leaned closer and inhaled carefully, just enough to sample the air without drawing it deep. Her stomach tightened. There was a smell under the antiseptic. Sweet and faint, like rotting fruit buried beneath bleach. A smell that did not belong in a hospital room. Her eyes lifted to the ceiling vent, then to the patient's face again. "This is not cardiac," she said. Her voice stayed calm, but her tone changed. It sharpened. "This is chemical." The nurses froze as if the word itself had weight. Dr. Larkin blinked. Chemical exposure in an ICU room. Maya did not argue. She reached for the nurse's wrist and lowered her hand from the patient's face for a second, just long enough to stop her from leaning into the plume of exhaled air. "Get everyone out," Maya said. "Now. Respiratory can come back with proper protection." The nurse at the head stared at her. "He cannot breathe." "I know," Maya said. "If this is what I think it is, you are breathing it too." Denise did not hesitate. She pulled the curtain wider, raising her voice without shouting. "Clear the room! Move!" One nurse backed away, first eyes wide. Another nurse followed, half resisting, then obeying. Dr. Patel stepped back with them, his face pale. Caldwell's officers moved to the doorway, controlling the hall with practiced stillness. One of them spoke into his radio voice clipped. Possible hazardous exposure in ICU. Lockdown corridor access. Reddick pushed into the room like authority could protect him. What are you doing? He snapped. You cannot evacuate an ICU room based on a hunch. Maya turned toward him slowly. Her cheek bruise stood out stark in the fluorescent light. Her eyes were steady. This patient was stable, she said. Now he is suffocating without a visible cause. That is not a hunch. That is a pattern. Reddick's jaw tightened. What pattern? Maya held his gaze. The kind that does not show up in a chart until people start dying. Dr. Larkin stepped in, trying to anchor the moment in policy. Maya, we need data. Labs. ABG. We cannot call chemical exposure without confirmation. Maya did not look away from the vent. Start your labs. But stop putting unprotected staff in this room. Denise nodded once, then leaned into the hall. Get masks. Get respiratory with equipment. Call security. Call infection control. Caldwell's gaze snapped to Maya. You have seen this. Maya's throat tightened. For a second, the tent smell came back. Dust. Diesel. A radio crackling and then going dead. A man on a cot whose lungs were failing and no bullet hole to blame. Yes, she said quietly. Reddick scoffed, but it was weaker now, the sound of a man losing control of his own narrative. This is Washington, not overseas. Maya looked at him. Air is air. Lungs are lungs. Caldwell leaned closer, lowering his voice so only she could hear over the alarm. If it is chemical, how did it get here? Maya did not answer immediately. She scanned the room, the vent above the bed, the IV tubing, the water cup on the tray, the oxygen line, the staff who had been near him all morning. She pointed at the water cup. Who brought that? A nurse in the hall raised a shaky hand. I did. From the station. It was sealed. Maya nodded. She did not accuse. Accusations wasted time. Another nurse rushed up with a portable pulse oximeter, hands trembling. His saturation is dropping. 68. Maya stepped to the bedside again, careful not to inhale deeply. She placed a hand near the patient's jaw to steady his head, not to comfort him, but to align his airway. Sir, she said, voice firm and close. Listen to me. Keep your eyes on me. Breathe slow, in and out. The patient's eyes flicked to her. He tried. The effort made his face strain, tendons standing out in his neck. Kim arrived with a mask in her hands, her eyes scanning Maya's face for direction. Maya shook her head once. Not that one, Maya said. That helps him, but it does not help us if the room is contaminated. We need proper filtration. We need to stop exposure. Kim swallowed and nodded, then turned toward the nurses. Get the crash cart outside the room. Get a ventilator set up ready. Denise moved like she had done this 1,000 times. She directed traffic with short sentences. She sent someone to call pharmacy. She sent someone to get a portable fan for negative pressure, then corrected herself because fans could spread things. She caught her own mistake and adjusted without flinching. Competence under pressure. Caldwell's officer came back, radio pressed to his mouth. We are locking the ICU wing doors. Security is rerouting visitors. Reddick's face tightened. You cannot lock down my hospital. Caldwell turned to him. His voice stayed quiet. You are not the one who decides whether this becomes a mass casualty event. Reddick's nostrils flared. His eyes jumped from Caldwell to the staff, reading their obedience like betrayal. This is hysteria. Maya looked at Reddick as if he were a lab value that did not make sense. Then explain why he went from stable to cyanotic in minutes. Reddick opened his mouth. Nothing came. A respiratory therapist arrived at the hall entrance with a cart, eyes wide. I heard rapid. What do you need? Maya stepped back into the hall, keeping the therapist from walking straight into the room. PAPR, or at least N95 with face shield. Full protection. We intubate if he cannot maintain airway, but we do it safely. The therapist nodded, already turning to fetch equipment. Kim tapped a screen on her tablet, pulling up the patient's vitals trend. He was stable, she whispered almost to herself. It does not make sense. Maya watched the numbers, then watched the vent again. It makes sense if someone wanted it to happen. Denise's eyes flicked to Maya. Say that again. Maya did not raise her voice. 2 unusual events in 1 hour. 1 targeted wound. 1 sudden collapse. In a building full of vulnerable people and controlled systems. That is not coincidence. Dr. Larkin's expression tightened. We need to be careful. Maya nodded once, accepting the caution, but not the delay. Careful does not mean slow. Caldwell's posture shifted. His attention lifted to the ceiling, as if he could see the ducts behind it. He spoke to one of his officers. Identify the hospital mechanical access points. Find who has clearance. The officer nodded and moved off quickly, boots quiet. Reddick turned toward the ICU desk, voice sharp. I want a full incident report. Now. Who let her in here? Who authorized this panic? Denise's voice cut in, controlled. Nobody authorized a crisis, Charles. It arrived. Reddick's face flushed at his first name being used in front of uniforms. Do not. Denise did not blink. You hit her in front of staff. You can handle hearing your own name. Reddick's mouth tightened into a line. His eyes darted, looking for control, and found none. In bed 12, the patient's breathing worsened. He began to seize small jerks first, then a stronger tremor through his arms. Maya moved in again, taking the man's hand in both of hers, anchoring him so he did not pull out lines. She leaned close. Stay with me, she said. Listen to my voice. His eyes rolled, then fixed on her, unfocused. His lips moved, but no sound came. Kim stood at Maya's shoulder, voice shaking. We need to intubate. Maya nodded. When respiratory brings proper gear, Dr. Patel swallowed hard. If we wait, he might arrest. Maya's eyes flicked to Patel. The irony hung in the air. Waiting. Always waiting. We are not waiting, Maya said. We are controlling exposure. That is not the same thing. A nurse returned with protective masks, distributing them fast. Caldwell's officer put one on without fuss. Caldwell did the same movements, smooth and practiced. Reddick hesitated, then accepted one as if it offended him. Maya fitted her mask and checked the seal by habit. The moment it settled, she felt her breathing slow. Caldwell stepped closer, his voice muffled by the mask. If someone did this, they are still here. Maya nodded. Yes. Caldwell's eyes sharpened. How do you know? Maya looked at the patient, then at the vent. Because exposure like this is not accidental unless a system failed. Systems do not fail in one room on one man at one time without someone creating the failure. Reddick shook his head, mask bobbing. This is speculation. Maya turned toward him. You want a simpler story because simple stories end quickly. Reddick's eyes narrowed. And you want drama. Maya's voice stayed flat. I want oxygen. A radio crackled near the nurse's station, the sound sharp in the quiet. One of Caldwell's officers listened, then his head snapped up. Unauthorized access alert, the officer said. Supply wing, door forced. For a second, the hallway went still again. Not from shock this time, but from calculation. Supply wing meant chemicals, medications, needles, linens, equipment. Supply wing meant anything could be introduced anywhere. Caldwell's gaze met Maya's. He did not need to ask if she understood. Maya's stomach tightened. The smell she had noticed in bed 12 suddenly felt less like a mystery and more like a signature. Denise stepped forward, voice firm. Security needs to lock it down. Reddick's mask shifted as he spoke, voice sharper. Supply wing is controlled access. Only staff. Kim's eyes widened. Then it is staff. Reddick snapped his head toward her. Do not say that. Caldwell spoke to his officers with the calm of someone used to turning fear into action. 2 teams. One stays here. One comes with me. One officer nodded and stayed near the ICU room holding the corridor. The other moved to Caldwell's side. Maya took 1 step forward. Caldwell's gaze flicked to her. No, Reddick said immediately, the word bursting out. She is not part of any response. She is not employed. She is a liability. Maya looked at him through the mask. Her eyes were steady. People are collapsing. That is not liability. That is reality. Caldwell's voice was calm. She is coming. Reddick's hands clenched. You cannot commandeer staff. Caldwell turned his head slightly. Then stop treating them like property. Denise moved toward Maya, placing a hand on her arm for a brief second, not holding her back, just making contact. Stay sharp, Denise said. Maya nodded, then adjusted the box strap that still cut into her forearm. She realized she was still carrying it, her things, her life, as if she had been trying to walk out while her body kept walking back in. She set the box down against the wall by the nurse's station. The sound of cardboard on tile was small but final. Kim watched her. You are not leaving, Kim, said voice low. Maya did not answer. She simply turned toward the hall. Caldwell moved first. Maya matched him. Dr. Larkin and Patel followed a few steps behind, pulled by their own unwilling curiosity and duty. Reddick hesitated, then came to, because he could not stand being excluded from a crisis happening in his own building. They moved fast, but not frantic. The ICU faded behind them, replaced by the harsher noise of the main corridor. Overhead lights reflected off polished floors. Doors whispered open and closed. A few patients watched from room windows, faces pressed to glass, like they could sense the tension without understanding it. At the intersection near radiology, a security guard ran toward them breathless. Supply wing door is open, he said. I did not authorize access. I saw someone in scrubs go in, but I could not see their face. They moved fast. Reddick's eyes narrowed. We have cameras. The guard swallowed. The camera feed is glitching. It went out a minute ago. Maya felt her skin prickle under her scrubs. Cameras did not glitch on command unless someone wanted them to. Caldwell's officer spoke into his radio, short and sharp. Seal that corridor. No one in or out. They turned into the supply wing hallway. The air smelled different here. Less antiseptic, more plastic and cardboard, and something faintly chemical, the smell of cleaning agents stored behind locked doors. As they got closer, the floor ahead glittered with shattered glass. A cart lay on its side, supplies scattered like someone had kicked open order itself. A metal tray skidded slightly as a ventilation draft brushed past it. Maya stopped before the open door and lifted a hand. Hold, she said. Caldwell stopped instantly. So did his officer. Dr. Patel almost bumped into them, then froze, eyes wide. Maya's gaze fixed on the floor just inside the doorway. A small vial lay shattered near the threshold, clear liquid smeared in a thin line across the tile, catching the light. The sweet wrong smell rose again stronger here, and it hit Maya like memory. She breathed shallow through her mask and felt her pulse settle into that old, familiar readiness. Do not breathe in, she said, voice low but absolute. Not even for a second. Maya held her hand up, palm open, and everyone obeyed without arguing. Even Reddick stopped on instinct, his polished shoes planted inches from the smeared line on the tile. The sweet smell pushed against the mask filter, faint but insistent, like a memory refusing to stay buried. Caldwell's officer angled his body, scanning the corners of the supply corridor. Dr. Patel stared at the shattered vial as if it might explain itself. Dr. Larkin kept his mouth closed, eyes working, trying to turn panic into a differential diagnosis. Maya crouched, careful with her balance, careful with her breath. The clear liquid had spread thin, not a puddle more, like a deliberate streak, as if someone wanted it to evaporate fast. Denise's voice came through Maya's earpiece memory, even though Denise was not here. Clear the room. Move. The same phrases, the same urgency, the same truth. Maya rose slowly and backed them away from the doorway by inches, guiding with her fingertips in the air. Seal it, Caldwell said to his officer. The officer spoke into his radio. Close supply wing doors. Block access at both ends. No entry without protective equipment. A security guard farther down the corridor jogged up and stopped short, face tight behind a surgical mask. I tried the lock. It was forced. I heard something crash, then it went quiet. Reddick shook his head, disbelief fighting with fear. This is a hospital. How does someone force a controlled door? Maya did not look at him. The same way they force anything. They want it open. Dr. Larkin's eyes flicked to Maya. We should call hazmat. Caldwell's officer answered before anyone else. Already doing it. The officer's voice came again, muffled but precise. and law enforcement. Reddick snapped toward him. You do not call outside agencies without administration approval. Caldwell's gaze cut to Reddick. Your approval is not required for oxygen and safety. Reddick's jaw tightened, and he looked like he wanted to argue, but his eyes kept returning to the open doorway, to the thin streak of liquid, to the glitter of broken glass. His anger did not disappear. It just had to share space with something colder. Maya listened to the building. Not the voices, not the radios. The building itself. The low hum of ventilation. The distant beeping of monitors. The soft wheeze of elevator cables. Hospitals had a sound. When something was wrong, the sound changed. A nurse appeared at the corridor intersection, clutching a tablet. Her face was pale. The ICU patient in bed 12 is worse. Respiratory is intubating. Another nurse just reported dizziness near the medication room. Maya's stomach tightened. Dizziness was how these stories started. A symptom that made people shrug until someone collapsed in public. Caldwell turned his head slightly. How many reports? The nurse swallowed. 2. Maybe 3. Reddick stepped forward, voice sharp. This is spiraling because you are telling people there is a chemical threat. Maya stared at him. It is spiraling because people are breathing something they should not be. A quiet crackle came from the wall speaker near the supply wing door. It was subtle, the pre-click before announcements. Everyone heard it at once and went still. The intercom clicked again, and the hall fell silent in a way no administrator could command. A voice poured through the speaker, calm, clear, unhurried, the kind of voice that did not rush because it believed it owned the room. Attention, it said. This is your final warning. The words did not echo, they settled. A nurse down the hall froze with a tray in her hands. The metal clinked once against the cart rim, then stopped. Somewhere behind them, a monitor alarm chirped unanswered for a beat too long. A patient's distant cough sounded suddenly loud, too human, too fragile. Maya did not move, her eyes fixed on the wall speaker as if it had become a mouth. Caldwell's officer turned, scanning the hallway as if the voice might step out of the drywall. Reddick's face tightened. Who is on the system? Security cut the feed. The intercom voice continued, unbothered by his command. Do not run, it said. Do not call anyone you think will help. You will only waste time. Caldwell lifted his radio. Trace that audio source. The officer beside him spoke quickly into his own radio, relaying the order. Maya felt her hands go cold under her gloves. The voice was filtered slightly, but the cadence was familiar in a way that made her throat tighten. It was not a voice you forgot. It was a voice built to make people obey without shouting. The speaker clicked once more, then softer, almost conversational. You always hated suspense, Maya. Her breath caught against the mask. Dr. Patel's eyes snapped toward her. He said your name. Maya kept her gaze on the wall speaker. The corridor around her blurred at the edges. For a fraction of a second, she smelled canvas and dust beneath the hospital disinfectant. She heard a different intercom, a radio, a voice in her ear, in a place where walls were fabric and the air tasted like sand. Caldwell looked at her sharply. You know him. Maya's jaw tightened. Yes. Reddick's voice rose sharp with disbelief. This is impossible. No one is using our hospital intercom to target a nurse. The voice answered him without acknowledging him. You should have stayed gone, it said. You were very good at that. Maya felt the words land under her ribs. They hit a place she kept locked down, the place where she stored names she did not speak out loud. Caldwell stepped closer to her, voice low. Say it. Maya swallowed. Her mouth felt dry even under the mask. Someone who was supposed to be dead. Reddick stared at her. What does that mean? Maya did not look at him. She did not want to see his reaction. She wanted to keep her eyes on the only thing that mattered, the voice that had found a way into the building's nervous system. The speaker clicked again, and the calm voice returned to its earlier tone, addressing everyone. This facility has been warned, it said. You will stop interfering. You will stop investigating. You will stop pretending you have control. A nurse down the corridor whispered, "Oh my God," and began to cry quietly, her hands trembling as she covered her mouth. Caldwell's officer spoke into his radio. We cannot find a local origin yet. It is riding the system. Caldwell's gaze narrowed. Then isolate the system. Shut down non-essential audio. Reddick snapped, "You cannot shut down hospital communications." Caldwell did not look at him. "Watch me." Maya's eyes stayed on the speaker. She was listening for more than words. She was listening for the person behind them, for the intention, for the familiar rhythm of a man who enjoyed being heard. She took a slow step toward the wall panel beneath the speaker where the call button sat behind plastic. Caldwell's officer shifted, ready to stop her. Caldwell lifted a hand, halting his officer with a small motion. "Maya," Caldwell said quietly, warning and question together. Maya's voice stayed steady. "If he can speak to us, he can hear us." Dr. Larkin's eyes flicked between them. "Do not engage. We do not know what he is capable of." Maya stared at the call button. Her finger hovered. She could feel the old fight in her body, the one that had learned not to wait for the right moment because the right moment did not exist. Caldwell's voice tightened. "Do not give him anything he can use." Maya nodded slightly, acknowledging the risk, and pressed the button anyway. A soft tone sounded in the panel. Maya leaned close, voice controlled. "I am here." The hall held its breath. For a moment, there was only the distant hum of ventilation and the faint squeak of a cartwheel somewhere far away. Then the intercom chuckled, low, warm, wrong, still trying to save everyone. The voice said, "That is what got them killed." Dr. Patel stiffened. "Them." Maya's eyes closed for half a second. She opened them again and kept her voice even. "You do not need to hurt anyone else," she said. The voice did not change. "Need is a word people use to excuse weakness. I am not weak." Caldwell moved closer, his presence firm at Maya's shoulder. His officer's hand hovered near his holstered weapon, useless against drywall and air. "Maya," Caldwell said under his breath, "he is baiting you." Maya nodded once. "I know." The speaker clicked and the voice returned quieter, like it was leaning in. "You are in a building full of rules," it said. "You always did love rules when they served you. Let us see how they serve you now." The lights flickered. Not the normal flicker of old fluorescent tubes, but a deliberate dip, a breath of darkness, then light again. Somewhere deeper in the hospital, a ventilation fan roared to life, loud enough to be heard through walls. The sound climbed quickly from background hum to mechanical insistence. Maya's head snapped up. She felt Caldwell's attention lift too, following her gaze toward the ceiling. Dr. Larkin blinked. "That is not scheduled. That is not how the system cycles." Maya did not wait for him to finish. She moved down the corridor, eyes tracking vents, listening to the fan's rising pitch. "He is in the ventilation controls," she said. Reddick scoffed, but his voice shook. "You do not know that." Maya turned her eyes on him, and the calm in them made his denial look childish. "He just told us he is testing control. That is where control lives in a building." Caldwell spoke into his radio. "Locate mechanical access. Now. Lock down every entry. Identify anyone in scrubs without badge verification." His officer relayed the command in clipped bursts. A nurse ran up from the ICU side, breathless. The vents in room 12 just surged. The airflow changed. "It is colder. It is stronger." Maya's pulse steadied into a hard rhythm. The pieces aligned. A targeted wound. A forced door. A vial. A voice. The building's lungs waking up on command. She looked at Caldwell. "If he pushes something through the ventilation, it will not stay in one room." Caldwell's gaze hardened. How long? Maya listened to the fan, to the way it climbed and stabilized. "Not long." Dr. Patel swallowed. "Where is the control room?" Reddick answered automatically, as if grateful for a fact he could own. "Basement level. Mechanical access is restricted. Badge and key." Maya's eyes never left the ceiling. "Restricted does not mean safe." Caldwell turned to Reddick. "You will provide access." Reddick's face tightened. "I am not giving military personnel access to critical infrastructure." Caldwell's voice stayed calm. "Then you can explain to the families why you protected doors instead of people." Reddick opened his mouth, then closed it. The argument died in his throat. He gestured stiffly toward a service corridor. "This way." They moved fast. Caldwell and his officer in front. Maya close behind her steps, light controlled. Dr. Larkin and Patel following, caught between duty and disbelief. Reddick, trailing face pale under the mask, one hand pressed to his phone as if a lawyer could stop air. As they passed the ICU desk, Kim looked up, eyes wide. Maya. Maya did not slow. Keep the doors shut. Keep staff protected. No one enters bed 12 without proper filtration. Kim nodded quickly. Understood. A few visitors stood clustered near the elevators, guarded now by hospital security who looked uncertain and afraid. One woman clutched her purse to her chest and asked, "Is it safe?" No one answered her directly. The truth did not fit in a single sentence. Maya felt the building's hum under her feet, the vibration of the fans, the quiet tension in every step. Behind them, the intercom clicked one last time, the calm voice threading through the corridor like a hand on the back of the neck. "Run faster," it said softly. "You will want the chance to fail up close." Maya did not turn around. She did not feed the voice another word. She followed the sound of the hospital's lungs waking down toward the basement where control panels lived, where air could become a weapon, and where the clean rules of a civilian building met the dirty logic of someone who had come to prove they meant nothing. The service corridor swallowed their footsteps and replaced the hospital's bright noise with something older and colder. Concrete underfoot, exposed pipes overhead, a faint drip somewhere in the dark. The air down here smelled like dust, trapped in filters, and the sharp bite of industrial cleaner, a scent that never reached patient floors because people were not meant to think about the building's bones. Maya walked close behind Caldwell, eyes up listening. The ventilation roar was clearer now, not just sound, but pressure, a steady push, moving through the walls. Every few seconds, a metal panel vibrated softly as if the hospital was breathing harder than it should. Reddick kept one hand on his phone thumb, hovering over the screen like a lifeline. He glanced at doors, at cameras, at Caldwell's uniform, as if any of it might become evidence in a lawsuit. "This is restricted infrastructure," he muttered. "If you damage equipment, you could shut down life support." Caldwell did not break stride. "If someone controls the airflow, they can shut it down anyway." Dr. Larkin and Patel followed a few steps back, both quieter now. The farther they moved from the ICU, the more the scene stopped feeling like medicine and started feeling like a response to an attack. Patel's breathing sounded too loud in the corridor. Larkin's face was set in the strained calm of a man who wanted to believe in protocols, because protocols were the only thing standing between order and panic. Caldwell's officer spoke into his radio in short bursts, words clipped and precise. "Reyes to unit establish perimeter at basement access points. No one enters mechanical corridor without verification. Confirm the location of ventilation control. Confirm the location of any chemical storage." A hiss of response came back. "Copy." Maya's gaze swept the corridor walls. Painted cinder block. Utility signs. A red emergency light above a steel door. The kind of place where you could scream and no one upstairs would hear you. They reached a service elevator with a metal gate and a keypad that looked older than most of the staff. A laminated notice was taped beside it, warning about authorized access only. The paper curled at the edges from humidity. Reddick stepped forward and swiped his badge. The keypad blinked red. He tried again. Red. His jaw tightened. The system is under strain. When power cycle's security locks can lag. Maya watched his hands. They were shaking stout enough to notice. Caldwell looked at the keypad, then at the camera above it. The camera's tiny red light was off. "That is convenient," Maya said quietly. Reddick snapped his eyes to her. "We are in an emergency. Not everything is sabotage." Maya met his gaze through the mask. "Not everything, just enough." Caldwell's officer stepped in front of the elevator and produced a small key from his pocket. Not a skeleton key, not a magic tool, just a piece of metal that looked like it had lived in a uniform for a long time. He opened a narrow panel on the side of the keypad, turned the key once, and the elevator gate released with a reluctant clunk. Reddick stared. "That is not hospital property." "It is not your concern," Caldwell said. The elevator car smelled like old rubber and disinfectant. The lights inside buzzed with a low, angry hum. Maya stepped in last. and felt the subtle vibration through the floor, the same vibration she had felt in the trauma bay before the helicopter landed, only heavier now. As the doors slid shut, the ventilation roar deepened like the building had drawn a long breath and did not plan to exhale. The elevator dropped, not smoothly. It shuddered once, then settled into a steady descent. Patel swallowed hard. Larkin stared at the seam between the doors, as if the metal might open too soon. Reddick cleared his throat. Mechanical control is maintained by facilities. You cannot just barge in. Caldwell's voice remained flat. If your facilities staff are doing their job, they will not object. Maya kept her eyes on the floor numbers. Basement, sub-level 1, sub-level 2. The numbers were not just floors. They were distance from help. The elevator stopped with a jolt. The doors opened into a wider corridor, darker, warmer, and louder. The sound hit them immediately, a thick mechanical rush that filled the space. It came from the ducts, from the fans, from the bones of the building. A faint red light pulsed at the far end of the hall. An alarm beacon, not blaring, not flashing wildly, just blinking with patient insistence. Maya stepped out and stopped for half a second, listening. The air moved differently down here. It was not the soft drift of conditioned air. It was directed, pushed, a current with intent. Caldwell moved beside her. You feel it? Maya nodded. The flow rate is high, higher than normal cycling. Reddick scoffed, but he kept close now, shoulders tight. You cannot know that. Maya did not turn her head. I can hear it. They moved down the corridor, shoes quiet on concrete. Pipes ran along the ceiling, some wrapped in insulation, some bare and sweating. Condensation dripped into shallow floor channels and disappeared into grates. Halfway down, a door on the left stood slightly open. The sign on it read, Facilities Storage. Caldwell's officer raised a hand, halting them. He leaned in, listening at the gap. Silence. Then a soft clatter like metal tapping metal. The officer drew his sidearm, but kept it low, muzzle angled down. He pushed the door open with his shoulder. Inside, shelves of filters and boxes. A mop bucket. A few folded coveralls. Nothing moved. Maya's gaze dropped to the floor. There were wet footprints leading out of the room, fresh enough to gleam. Reddick frowned. Maintenance has been mopping. Maya followed the prints with her eyes. They were too narrow for rubber boots. Too light for heavy work shoes. They had the clean outline of standard hospital clogs. Someone had walked through liquid and kept going. Caldwell's officer stepped back into the corridor, weapons still low. Reyes to unit. We have fresh foot tracks in sub-level 2, heading toward ventilation control. A voice crackled back. Copy. Locking access points. Maya moved again, following the prints. Her heart stayed steady, not because she was calm, but because her body had learned what panic cost. She counted doors as she passed them. Electrical, boiler, laundry intake, duct access. She noted cameras that were dark emergency lights that were blinking, a faint smell that came and went like a tide. Reddick spoke through clenched teeth. If this turns out to be nothing, I will have to report this entire intrusion. Caldwell did not answer. The corridor opened into a junction with 3 paths. One path led to a large door marked mechanical control. Another led to waste and sterilization. The third disappeared into darkness. Maya stopped near the mechanical control door and leaned slightly toward it. The ventilation roar was loudest here. Beneath it, she heard a softer sound, irregular, like a hand tapping plastic. Caldwell's officer lifted his radio. Confirm status of mechanical control room cameras. The answer came back quickly. No feed. Power is present, signal is dead. Reddick's face tightened. Our camera system does not simply die on one corridor. Maya looked at him. It does if someone wants privacy. Caldwell stepped toward the door. It was thick steel with a keypad and a card reader. A small green light above it was off. Reddick reached for his badge again. I will open it. He swiped. Nothing. He swiped again, harder, as if force could persuade electronics. Still nothing. Reddick's voice climbed. This is a security system malfunction. It requires EA. We cannot open it manually. There are protocols. Caldwell turned his head slightly. Your protocols are not working today. Maya watched the door seam. There was a thin line of air moving through it, a faint pressure that made the dust near the threshold drift outward. The room beyond was pushing air into the corridor. It should have been the opposite. Maya's mouth went dry under the mask. "He is inside," she said. Reddick's eyes widened. "That is an assumption." Maya did not look at him. "The door is dead. The cameras are dead. The airflow is wrong." Caldwell's officer stepped closer to the reader, examining the panel. "The system is cut, not glitched." "How do you know?" Patel asked, voice thin. The officer pointed with one gloved finger. "The power indicator is dead, but the conduit is warm. Someone interrupted it recently." Reddick's throat bobbed. "You are accusing someone of tampering with federal-grade infrastructure." Caldwell's gaze stayed on the door. "I am stating the obvious." Maya scanned the corridor again. No movement, no footsteps. Only the building's lungs roaring above them. She felt a memory flicker, not as a story, but as sensation. A tent flap snapping in wind. A generator coughing. A voice on a radio telling her not to go in, telling her to wait. Telling her help was coming. Help rarely arrived on time. Maya looked at the keypad, then at the emergency placard beside the door. In small print, it listed an override procedure. There was an emergency key box. And there was a code. Reddick, Maya said, her voice controlled. "Where is the mechanical override key?" Reddick stared at her. "No." Caldwell turned to him. "Yes." Reddick's face flushed. "Opening that box logs access. It will trigger audits. It will flag the building as compromised. This is not a decision to make in a hallway." Maya's eyes narrowed. "Your building is already compromised." Reddick's jaw clenched. "You do not know that." Maya's voice stayed flat. "Then explain the intercom. Explain the forced door. Explain bed 12. Silence. Reddick's gaze flicked down the corridor as if hoping someone else would take the choice away from him. Caldwell stepped closer until he was within a foot of Reddick. He did not loom. He did not shout. His calm was more frightening than anger. "This is no longer about your logs," Caldwell said. "It is about containment." Reddick swallowed, then reached into his suit pocket with a hand that did not want to. He pulled out a small ring of keys. He held it up like it weighed 100 pounds. "This is absurd," he said, voice tight. "If you break something, if you damage the system, I will hold you responsible." Caldwell did not take the keys yet. He looked at Reddick as if measuring the man's spine. "You already damaged something," Caldwell said. "You damaged trust." Reddick's eyes flashed. "I am trying to keep a hospital running." Caldwell's voice remained calm. "Then stop being the problem in the hallway." Reddick's hand shook. He pushed the keys toward Caldwell. Caldwell's officer took them instead, moved to the emergency key box beside the door, and inserted a key. The box clicked open. Inside was a red handle and a laminated card with a printed numeric code. The officer read the code once and entered it into the keypad. The keypad flickered, then lit up dimly, as if waking reluctantly. A faint beep sounded. The green light above the door blinked once, then stayed off. The officer tried again. Same beep, same failure. Maya listened to the door. The tapping sound inside stopped. For a second, the corridor felt like it had been noticed. Caldwell's officer stepped back. "The reader is disabled. We can breach." Reddick's eyes widened. "No, you cannot force that door. It is pressurized. It is tied into the building ventilation. If you breach it incorrectly, you could change airflow across multiple floors." Maya's gaze stayed fixed on the seam. "Airflow is already changing across multiple floors." Caldwell looked at his officer. "Do it clean." The officer holstered his weapon, then moved to the side of the door. He tested the frame with his hand, found the weak point near the latch, and planted his foot. Patel's eyes widened. "Is that safe?" Maya did not answer. She watched the door like it was a patient on a table. The officer hit the frame hard with his shoulder. Metal rang. The door did not give. He hit it again. A crack sounded not from the door itself, but from the latch housing. On the third hit, the seal broke with a sharp pop, and the door swung inward a few inches, caught by a secondary chain. A rush of air pushed out into the corridor, cool and forceful. It carried that sweet, wrong smell, stronger now, layered with oil and dust. Maya stepped back and pulled Patel with her by the sleeve. "Stay out of the direct flow," she said. The officer unhooked the chain carefully and pushed the door wider. Inside the mechanical control room was lit by harsh fluorescent strips. The air was colder. The roar was deafening. Rows of ducts ran overhead like massive arteries. Control panels lined the far wall, blinking with status lights, some green, some amber, some red. A digital display near the center flashed an error code, then another, as if the system could not decide which failure mattered most. Caldwell stepped in first, posture steady. His officer followed, scanning corners. Maya entered last, staying close to the doorframe for a moment to orient herself. The room smelled like metal and moving air, and beneath that, the faint chemical sweetness that did not belong. Reddick stood at the threshold, pale eyes darting across the panels like a man seeing his empire stripped down to wires. "This is insane," he whispered almost to himself. Maya's attention went to the main control panel, the largest one, where a bank of switches sat behind a clear cover. Above it, a warning label in bold letters indicated emergency override. The clear cover was open. A hand had been there. On the floor near the panel lay a discarded hospital badge. Face down, its clip snapped. Maya crouched and flipped it over. "Facilities, name Aaron Pike." Reddick's eyes flicked down. "He is one of my maintenance supervisors." Maya's voice stayed low. "Then someone is wearing his access, or he is inside." Caldwell's officer stepped toward a side console. He touched the screen, then pulled his hand back quickly. "It is warm," he said. Maya felt her pulse tighten again. Warm meant recent. Caldwell's gaze tracked across the room, following the direction of airflow, following the duct lines to the central fan array. The fan housings vibrated with power. A pressure gauge needle trembled near the high end of its range. Then Maya saw it. A figure near the far panel, half turned away, dressed in hospital scrubs mask, pulled down under the chin, as if rules did not apply down here. The figure's hand rested lightly on the emergency override switch, fingers poised as if it were an instrument key. He turned his head slowly, and his eyes found Maya through the roar and the fluorescent glare. Even from across the room, she recognized the shape of that calm. The familiarity hit her like a cold wave. The man smiled, small and certain. "You made it," he said, voice almost gentle, as if they had bumped into each other in a quiet hallway instead of a room that controlled a hospital's lungs. The smile on Evan Cross looked like it had been practiced in mirrors, the kind of expression that made people doubt their own instincts. He stood in hospital scrubs that fit too cleanly, mask hanging loose beneath his chin, hair tucked back like any staff member headed to a supply room. Only his eyes broke the disguise. They were steady and amused, as if the room belonged to him and everyone else was trespassing. Maya felt the roar of the fans in her teeth. The chemical sweetness threaded through the cold air like a warning. She did not step farther in. She anchored herself near the doorframe, keeping the pressure of the airflow off her face. Caldwell moved forward, one measured step, boots quiet on concrete, shoulders squared. His officer shifted slightly to the side, giving Caldwell a line of sight and a clear lane. "Hands off the panel," Caldwell said. Evan's fingers stayed exactly where they were, resting lightly on the emergency override, like a pianist on a first note. "Vice Admiral Thomas Caldwell." Evan said, voice calm, almost polite. "I expected someone from you, not you." Caldwell did not react to the name being spoken. His eyes tracked Evan's hand, the switch, the open cover, the ductwork overhead. "You are in a restricted control room," Caldwell said. "Step back. Now." Reddick hovered at the threshold, pale mouth slightly open. The hum of the fans seemed to swallow his breathing. His eyes darted from Evan's face to the badge on the floor to the open cover on the control panel, as if he could not decide which piece of evidence terrified him most. "You cannot be here," Reddick managed. "This area is for authorized personnel only." Evan turned his head a fraction, acknowledging Reddick like a man acknowledging a background prop. "Charles," Evans said, and there was mild amusement in the way he said the CEO's first name. "You built a cage with nice paint and thought it was a fortress." Reddick flinched. "How do you know my name?" Evans' smile deepened slightly. "People talk. People file reports. People make calls they should not make." Maya's stomach tightened. "Calls. The lawyer, the radios, the sudden speed of administration. She watched Evan's posture, the angle of his shoulders. He was relaxed, but not careless. He held his weight forward on the balls of his feet, like someone ready to move. Caldwell's voice stayed level. Identify yourself. Evan's eyes returned to Maya. She already knows. Maya's throat felt tight under her mask. The name rose in her mind like something she had tried to drown and failed. Evan, she said quietly. The sound of it did not feel like speech. It felt like reopening a wound. Evan's smile flickered, then steadied. There it is. Dr. Patel stood behind Caldwell, frozen eyes wide above his mask. Dr. Larkin held himself rigid, one hand half raised as if he might speak and stop himself at the same time. Neither of them belonged in this room. The moment did not care. Caldwell's officer kept his weapon low. Not because he trusted Evan, but because he understood the room. A bullet here could puncture something that changed airflow across floors. A bullet here could turn a crisis into a cascade. Caldwell lifted his own weapon, not fully extended, but enough to make intent clear. Step away from that switch, Caldwell said. Evan laughed softly. The sound barely carried over the roar of the fans, but it landed anyway. You are careful, Evan said. Good. Careful men live longer. Maya felt heat rise behind her eyes, then flatten into focus. What did you put in the vents? She asked. Evan's gaze stayed on her, still asking the right questions. Maya took one step forward, slow. Caldwell's head turned slightly toward her, a warning in his posture, but he did not stop her. Bed 12, Maya said. The vial in the supply wing. People are collapsing. Evan's expression did not change. People collapse every day in hospitals. You forced the door, Maya said. You killed the cameras. You spoke over the intercom. Evan's eyes narrowed with something like satisfaction. You noticed. Reddick found his voice again brittle with fear and outrage. This is terrorism. You are committing a federal crime in my facility. Evan looked at him again, slow. Your facility. Reddick swallowed hard. Security is on the way. Evan's fingers flexed on the edge of the switch cover. Then time matters, does it not? Maya's gaze locked on his hand. The fans roared. The pressure gauge needle trembled near the high end, vibrating like a heartbeat. Do not, she said. Evan's eyes returned to her. Do not what? Do not breathe. Do not move. Do not investigate. Do not come back from the place they buried you. Caldwell's voice cut through, controlled and sharp. You targeted my nephew. Evan's smile thinned. I touched your world so it would look at mine. Caldwell's jaw tightened. Why him? Evan's eyes stayed on Maya. Because he would survive long enough to arrive here. Because his blood would bring you down from wherever you hide behind flags and offices. Because saving him would put her hands on a familiar problem. Maya felt the words like cold water. Her fingers curled inside her gloves. You aim to keep him alive, she said. Evan nodded once, almost approving. You always were quick. Dr. Larkin exhaled, voice strained. This is insane. Evan turned his head slightly toward Larkin. You work in a building full of fragile bodies and call reality insane because it does not fit your forms. Larkin stiffened. I am trying to keep people alive. So am I, Evan said, and the lie was delivered with perfect calm. Maya's voice stayed low. You are hurting civilians. Evan's eyes returned to her. I am erasing witnesses. Reddick took a step forward, then stopped when Caldwell's officer shifted his stance. The CEO's face was slick with sweat now, the mask pressing into his cheeks. Who are you? Reddick demanded again, voice cracking. How did you get into my system? Evan's gaze slid back to him. You opened more doors than you realize. Maya remembered the snapped badge on the floor. Aaron Pike. Facilities. Access stolen or coerced. The broken camera feed. The dead green light. You did not come alone, she said. Evan's eyes did not confirm it, but his smile did. You are not the only one who has learned to use people. Caldwell's weapon steadied. Step away from the panel. Evan's fingers hovered closer to the switch now, not touching it fully, but close enough that the room felt like it had narrowed around that distance. One wrong move, Evan said, eyes on Caldwell, and this hospital becomes a box. Maya's mouth went dry. The fans roared like lungs being forced open. "What is in the system?" Caldwell asked. Evan's gaze returned to Maya, and his voice softened as if sharing a secret. "Not enough to kill everyone. Not yet. Enough to make you choose who gets air first." Maya felt something in her chest tighten. Choice. Triage. The oldest cruelty. Why, she said again. Why here? Evan's smile faded. For the first time, something hard showed through something wounded and furious. "Because you came back," he said. "Because you walked into a civilian hospital and pretended you were only a nurse. Because you think hiding behind a badge makes you clean." Maya's hands trembled once, then steadied. "I did not come back for you." Evan's eyes sharpened. "No. You came back because they told you to disappear, and you obeyed, and it made you sick, and you thought you could live a quiet life where nobody dies because of what you know." Maya swallowed. She could feel Caldwell watching her, reading the tension in her shoulders. Evan's voice remained calm, but the words cut deeper. "They buried it," Evans said. "The program, the trials, the people who did not survive. They wrote reports and called it necessary. They wiped names. They wiped faces. They wiped you." Maya's throat tightened. "You were declared dead." Evan shrugged a small motion. "Reports can be wrong." Caldwell's eyes narrowed. "You are confessing to a plot inside a civilian hospital." Evan's gaze flicked to him. "Confessing is for people who expect courtrooms. I expect consequences." The fans surged slightly, a subtle rise in pitch. Maya felt the change in pressure like a hand closing around her throat. Caldwell's posture shifted. His voice lowered. "Do not touch it." Evan's eyes returned to Maya. "You watched people die because you waited for permission once. Remember how it felt. Remember the tent. Remember the radio. Remember how they said help was coming." Maya's vision sharpened. The memory was not a picture. It was heat and grit and the sound of breathing turning into silence. "Stop," she said, voice rough. Evan's mouth curved. "You pressed the intercom button. You answered me. You walked down here. You always step into the fire when someone tells you not to." Maya stared at his hand. Caldwell's officer shifted, adjusting his stance near a side console, eyes tracking Evan's shoulders. He was ready to move, but he was calculating distance, airflow, collateral damage. Reddick's voice broke through, desperate. "Just take him! Arrest him! Get him out!" Evan turned his head, slightly amused again. "Arrest me in a room that controls your oxygen." He looked back to Maya. "Tell them," he said. "Tell them what happens if the switch flips." Maya's jaw clenched. "You pushed the chemical through the system." Evan nodded, pleased. "You learned," Dr. Patel whispered. "Oh my God." Maya's eyes stayed on Evan. "You will hurt children, patients on ventilators, people who cannot run." Evan's smile held. "Then you should stop me." Caldwell's voice was quiet now, aimed at Maya and his officer both. "Do not rush him." Maya did not answer. She was watching Evan's breathing. She saw the slight rise in his chest, the way his fingers tightened imperceptibly, the way his weight shifted to his back foot. He was preparing to move. The fans surged again, a brief spike. The pressure gauge needle jumped, then steadied. Maya felt the room tilt into decision. Evan's eyes locked on hers. "You could have walked out of the lobby." Maya took one small step forward, then stopped. "And let people suffocate." Evan's smile softened, almost kind. "That is why they will keep using you." His fingers dropped. Maya moved before thought could form. Her body launched forward, closing the distance in a sprint that felt like stepping off a cliff. Caldwell shouted her name, but the roar of the fans swallowed the sound. Evan's hand snapped toward the switch. Maya slammed into him. Their bodies hit hard, shoulder to chest, the impact driving Evan sideways away from the panel. The force knocked the clear cover further open. Evan's elbow shot up sharp, catching Maya in the ribs. Pain flared hot and immediate, stealing a fraction of breath. Maya did not let go. They stumbled together, boots sliding on concrete, and Evan twisted, trying to throw her off. He was stronger than he looked, not gym strength, the kind of strength that came from surviving and adapting. Caldwell's weapon rose, but he did not fire. His officer moved toward the panel, aiming for the switch cover, aiming to shut it if possible. Evan's hand whipped out, grabbing Maya's forearm, and he yanked her toward the duct line, as if to use her body to block Caldwell's shot. Maya ducked, shoved her shoulder into Evan's chest, and drove him away from the panel again. The fans roared. The room seemed to shake with it. A shot rang out, not from Caldwell. From his officer fired upward into a pipe junction above the panel, a deliberate miss that still hit something critical. Metal screamed. A line snapped. A burst of steam exploded into the room, white and hissing, filling the space with scalding fog. The roar of the fans became muffled as if the world had been wrapped in cloth. Maya's skin prickled. The heat hit her face, filtered by the mask, but still sharp. Evan laughed through the steam, a low sound close to her ear. "Good," he said. "Now you cannot see the switch." Maya's eyes watered. She blinked hard, tasting metal and heat through the filter. She grabbed Evan by the scrubs at his chest and drove him backward, both of them sliding on wet concrete. Evan's hand shot out, searching for the panel for the switch for any leverage. Maya hooked her foot behind his ankle and twisted. Evan went down hard, shoulders slamming into the floor. The impact knocked the mask under his chin up slightly. Maya saw his mouth tighten, then relax. He was enjoying the chaos. Maya's ribs burned where his elbow had hit. She forced her breath steady. Evan swung upward, aiming for her jaw. Maya leaned back, the fist grazing her cheekbone. She felt the sting, but it was nothing compared to the slap upstairs. This was honest violence. This had purpose. Maya drove her knee into his side. Evan grunted, then grabbed her leg and yanked. She stumbled and caught herself on a metal support beam glove, slipping on condensation. The steam thickened, swirling in the harsh fluorescent light. Somewhere behind it, Caldwell's voice barked orders into a radio. Reddick shouted something, then coughed, choking on the damp heat. Maya kept her eyes on Evan's hands. That was the only thing that mattered. Evan rolled, pushing to his feet. He moved fast, not toward the door, but toward the panel. He could see it through memory, if he could not see it through steam. Maya lunged and caught him at the waist. They crashed into the side console. Buttons beeped and flashed. A warning alarm chirped, a thin sound swallowed by the fans. Evan elbowed her again, harder this time, catching her shoulder. Pain shot down her arm. Her grip loosened for a fraction. Evan twisted free. His hand reached toward the panel, fingers stretching for the switch. Maya saw a loose cable hanging from the side console, thick and rubber-coated, damp with condensation. She grabbed it without thinking, looped it around Evan's wrist, and yanked with every ounce of strength she had. The cable snapped tight. Evan's hand jerked back. His fingers scraped the switch cover, but did not flip it. He turned on her, eyes bright, and for the first time, his calm cracked into something sharp. "You never learned," he hissed. Maya pulled again, dragging his wrist down and away from the panel. "I learned," she said through clenched teeth. "You did not." Evan surged forward anyway, using his weight to overpower the cable. Maya's shoulders screamed. She planted her feet and braced, feeling the pull in her ribs. Caldwell stepped into the steam weapon, raised, eyes narrowed. "Maya," he shouted the word, cutting through the roar. Evan looked toward the sound and smiled, teeth white in the fog. "Careful," Evan said. "You shoot, you hit something that matters." Caldwell did not fire. Maya's mind flashed to the pressure gauge needle, the trembling high end, the way the air had felt like a fist. She yanked the cable sideways and down, forcing Evan's wrist into the side of the console. The console sparked. A sharp crack of electricity snapped through the steam. Evan flinched just enough. Maya used the moment. She slammed her shoulder into his chest and drove him back. He stumbled, his heel slipping on the wet concrete. His hand reached out instinctively to catch himself. It landed on the panel, not on the switch. On the edge of the open cover. The cover slammed shut over the switch with a hard clack. Maya grabbed the edge with her glove and pressed down, forcing it closed, forcing the latch into place. Evan's fingers clawed at the plastic cover, trying to pry it back open. Maya locked her other hand around his forearm and twisted. Evan snarled, then surged toward her, trying to break her balance. Maya felt her ribs flare with pain again. She ignored it. She jerked the cable one more time hard, and the cable ripped free from the console housing, pulling a small connector loose. The panel lights flickered. The pressure gauge needle stuttered. The roar of the fans dropped half a tone, as if the building had been punched in the throat. Evan's eyes widened, the first real surprise. Maya shoved his shoulder with both hands and sent him sprawling away from the panel. He hit the floor hard, sliding in a streak of water and steam. The fans whined, "Yabimid." Then the sound cut out abruptly. Silence slammed into the room. Not total silence. Monitors somewhere upstairs still beeped faintly through vents. Radios still crackled. But the massive roar that had filled the space was gone. And in its absence, the world sounded fragile. Maya's ears rang. The steam began to thin, drifting toward the ceiling in lazy curls. Caldwell's officer moved in fast weapon up now, no longer worried about airflow surges. 2 more armed personnel poured in behind him, boots splashing through condensation. The corridor outside filled with shouted commands and hurried footsteps. Evan lay on his side chest, rising and falling, eyes fixed on Maya. He smiled again, slower this time, as if savoring the moment. "You could have left," he said quietly. Maya's hands trembled. She did not know if it was pain or adrenaline or the shock of the fans stopping. She swallowed and forced her voice steady. "And let this happen," she said. Evan's smile softened into something almost sad. "That is why they will never stop using you," he said. Caldwell stepped closer, weapon still raised. "It is over." Evan's gaze never left Maya. "No." Caldwell's officer grabbed Evan's wrists and hauled him up. Evan did not resist much. He allowed himself to be moved, like a man confident in the aftermath. Plastic cuffs snapped tight. Reddick stood near the door, coughing suit-damp hair disheveled. He stared at Evan with a kind of disbelief that looked like nausea. "You were in my building?" Reddick whispered. "All this time?" Evan turned his head slightly toward him. "It was never just your building." Caldwell's eyes flicked to the control panel, then to the disconnected cable, then to the pressure gauges. He spoke into his radio, clipped and immediate. "Ventilation override disabled. Confirm airflow stabilization on patient floors. Confirm hazmat containment. Confirm no additional devices in duct lines." A response crackled back. "Copy. Airflow is dropping to normal. ICU reports no further surges." Maya exhaled slowly, her breath shaking against the mask. Caldwell's officer pushed Evan toward the door. Evan stumbled once, then steadied. As he passed Maya, he leaned slightly closer, voice low enough that only she could hear it. "This is not finished," he murmured. "It is just louder now." Maya's jaw tightened. She did not answer him. The officers moved Evan into the corridor, boots splashing in the shallow water. The room felt suddenly too bright, too exposed. The control panels blinked error codes, like the building was trying to process what had just been done to it. Maya looked at the snapped badge on the floor again. Aaron Pike. She felt a cold anger tighten in her chest. Caldwell turned to her. His voice softened by a fraction. "Are you hurt?" Maya touched her ribs lightly and felt the bruise spreading beneath her scrubs. She nodded once. "I am fine." Caldwell's eyes did not accept the answer, but he did not argue. He glanced toward the door where his people were securing the corridor. "Get medical to this room," Caldwell ordered. "Check for chemical residue. Check for any secondary triggers." His officer nodded and moved. Reddick took a shaky breath and looked at Maya as if he was seeing her for the first time. Not a rookie nurse, not a liability. A person who had been standing between his hospital and disaster while he argued about logs. His mouth opened. No sound came out. Maya did not wait for him to find one. She looked at Caldwell. "Bed 12. Caldwell nodded once, immediate. "We go." Maya stepped toward the door, her legs steady now, her hands still trembling slightly. As she entered the corridor, the smell of steam and metal gave way to the familiar hospital scent again. Antiseptic and plastic and fear. Somewhere upstairs, a monitor alarm chirped, then steadied. The building kept breathing quieter now, and the count of beeping machines continued like nothing had the right to stop. They took the stairs instead of the elevator. Caldwell moved with the same controlled speed as before, but now the urgency had a sharper edge, the kind that came after you realized how easily a building could be turned against the people inside it. Maya kept one hand on the rail, ribs aching, with every step mask still tight across her face. The corridor air felt cleaner already, as if the hospital had noticed the fans had stopped forcing something through its lungs. On the ICU floor, the quiet was fractured. A cluster of staff stood near Bed 12's door in protective gear that made them look like strangers in their own unit. Plastic hoods, face shields fogged at the edges, gloves taped to sleeves. The respiratory therapist bent over the patient with a practiced focus, hands steady as he secured the tube eyes flicking between chest rise and monitors. Kim met them at the desk. Her gaze snapped to Maya's face, then down to Maya's guarded posture. "He is intubated," Kim said. His saturation came up a little after the airflow dropped. "We are running labs, tox screen blood gases. Infection control is here." Maya nodded once. The relief that tried to rise in her chest hit the bruise in her ribs and turned into a dull ache. She watched through the glass as the older man's chest moved with mechanical rhythm, the ventilator doing the work his body could not. Denise Parker appeared from the far end of the hall, hair pulled tight, eyes red with exhaustion and anger held in check. When she saw Maya, her shoulders lowered a fraction. "You look like you got hit by a truck," Denise said. Maya kept her voice even, just a person. Denise's eyes flicked to Caldwell, then to his officers, then back to Maya. She read the room fast. "Is it contained?" Denise asked. Caldwell answered calm and precise. "Ventilation override is disabled. My team is checking duct lines and access points. Hazmat is en route." Denise's jaw tightened. "En route. In an ICU," Maya spoke quietly. "We stopped the fans." That mattered. Denise studied her face, the swelling from the slap, now joined by the fresh scrape near her cheekbone from the basement struggle. Denise's gaze sharpened with recognition. Not questions, not yet. Just confirmation that Maya had been in the middle of it. Kim leaned closer, voice low. "We had 2 nurses report dizziness after Bed 12. They are in an empty room, monitored. No one else has collapsed since the fans shut down." Maya exhaled slowly through the mask. Her hands were still trembling, not visibly, but enough that she felt it in her fingertips. Caldwell looked toward Bed 12's room, then turned his gaze down the hall to the glass room where Ryan lay. 2 military guards stood outside it now, posture-rigid eyes scanning every passerby. The ICU had become a contested space without anyone saying it out loud. Reddick arrived moments later, escorted by a hospital security supervisor who looked like he wanted to disappear into his own uniform. The CEO's suit was damp at the collar, hair disordered, his mask replaced with a fresh one that sat too tight across his mouth. He stopped when he saw Caldwell, then when he saw Maya, as if both sights were equally offensive. "This has gone far enough," Reddick said, voice hoarse. "You breached critical infrastructure. There are federal regulations for hospitals. There are safety codes. You have no authority to conduct operations inside my building." Caldwell's eyes settled on him. "Your building was used as a weapon." Reddick's face flushed. "That is your claim. We have no confirmation." Maya shifted her weight and felt pain flare along her ribs. She kept her posture steady. She refused to give Reddick the satisfaction of seeing her wince. Denise stepped forward, voice level. "Charles, we had a patient collapse with no visible cause, staff reporting dizziness, a forced door, a broken vial, the intercom used to broadcast threats, and now a disabled camera feed in the basement. Stop pretending this is normal." Reddick's eyes narrowed. "You are a nurse. Stay in your lane." Denise's gaze did not flinch. "You hit one of your nurses. That is your lane now." The security supervisor swallowed and looked away. Caldwell spoke into his radio, clipped. "Bring law enforcement to my location." Reddick's shoulders stiffened. "You are turning this into a circus." Caldwell did not raise his voice. "You are the one who struck staff in a public trauma bay. That was your circus." Reddick's eyes cut to Maya. The anger in them was thinner now, threaded with something that looked like fear of consequences. "She refused reinstatement," Reddick said quickly, grabbing at the only piece of control he thought he still had. "She is not employed. She should not be in restricted units." Maya looked at him for a long beat. When she spoke, her voice was steady. "I did not follow you here," she said. "I followed patients." Reddick's jaw tightened. Caldwell turned his attention back to the ICU desk. "Kim, I want the names of every staff member who accessed the supply wing in the last 24 hours. Badge logs." camera records, even partial. I want medication cabinet access reports. I want facilities access records for the mechanical level. Kim nodded, already tapping at her tablet with gloved fingers. Yes, sir. Reddick stepped forward. Those records are protected. Caldwell's gaze hardened. Protecting records is not the same as protecting people. A uniformed Tacoma police officer appeared at the end of the hall, with two more officers behind him, faces, serious hands near belts. They moved past visitors with a kind of quiet urgency that made everyone step aside. Behind them came a fire department hazmat supervisor carrying a hard case, eyes scanning vents and doors. The lead police officer approached, eyes moving from Caldwell's uniform to the guards to the nurses in protective gear. I am Sergeant Alvarez, he said. We received reports of a hazardous exposure and an intruder. Caldwell nodded once. Vice Admiral Thomas Caldwell. The suspect is in custody with my security detail. Chemical exposure is suspected. We need coordination. Alvarez's eyes tightened. We need a scene. We need statements. We need to secure evidence. Reddick stepped in, relieved to see a system he recognized. Thank you. This facility will cooperate. I am CEO Charles Reddick. We need to ensure the hospital remains operational and protected from disruptions. Alvarez looked at him, then at Maya's face, then back at Reddick. His tone stayed neutral, but the question carried weight. Are you the one who struck staff? Alvarez asked. Reddick stiffened. That is an internal personnel matter. Alvarez's eyes stayed steady. It becomes my matter when it is assault. Reddick's mouth opened, then closed. Denise's voice was quiet. It happened in Trauma 1, in front of staff. Maya did not speak. She did not need to. The bruise on her cheek and the stillness in her posture did enough talking. Alvarez nodded once, then turned to a second officer. Get a statement from witnesses. Pull security footage. Talk to that nurse. Reddick's face went pale under the fluorescent lights. This is not necessary. We have procedures. We have human resources. Alvarez did not look at him. We have laws. Caldwell watched the exchange without satisfaction. He looked like a man who measured outcomes, not drama. The hazmat supervisor stepped toward Bed 12's room. We need to assess ventilation distribution. We need to sample air and surfaces. Who can walk me through the timeline? Maya lifted her gaze. I can. Kim's eyes flicked to her, then to Caldwell, asking permission without speaking. Caldwell nodded slightly. Go. Maya moved with the hazmat supervisor, keeping her steps controlled. Each breath pulled at her ribs, but she did not let it show. She pointed out the room, the vent above the bed, the time of collapse, the change in airflow, the smell. The hazmat supervisor listened, face serious. Sweet odor, rapid respiratory failure, dizziness among staff. Could be a range of agents. Maya kept her voice steady. The smell was stronger near the supply wing door and strongest near the shattered vial. The airflow surge felt controlled, not random. The supervisor nodded, then turned to his team. Get samples. Check duct access. Coordinate with facilities. Reddick started to protest, then stopped as if he had finally realized arguing did not change chemistry. In the hallway, Caldwell's officers remained posted near Ryan's room. Caldwell stepped closer to the glass and looked in at his nephew again. Ryan's chest rose and fell more naturally now, the ventilator no longer doing all the work. His eyes were still closed, but the tension in his face had softened. Caldwell's hand hovered near the door handle, then paused. He did not go in. He watched through glass like a man protecting himself from relief. Maya stood a few feet away, hands at her sides, feeling the bruise in her ribs and the older bruise beneath that the one Evan's voice had pressed on. She watched Caldwell watch Ryan. Kim returned to the desk and spoke quietly. He is coming out of sedation. He is responsive. Caldwell's head turned. Now. Kim nodded. Yes. We can bring you in one at a time. Denise looked at Maya. Do you want to sit? Maya shook her head. I am fine. Denise's eyes narrowed, not convinced. You are bleeding. Maya glanced down and saw a thin red line where her glove had torn during the struggle and scraped her wrist. She pressed it with her thumb. It is nothing. Denise exhaled, then stepped closer and lowered her voice. You keep saying that like it makes it true. Maya did not answer. She watched the guard outside Ryan's room shift, opening the door for Kim. Kim looked at Caldwell. You can come in. Just you. Caldwell nodded and entered. Through the glass, Maya saw him approach the bed. He did not rush. He did not touch any lines. He simply stood where Ryan could see him when his eyes opened. Ryan's eyelids fluttered, then parted. His gaze moved slowly, unfocused at first. Then it found Caldwell and sharpened slightly. Ryan's lips moved. The words came out rough, barely audible. Uncle. Caldwell leaned in slightly. You are in a hospital. You are safe. Ryan blinked a slow motion of disbelief. Safe. Caldwell's jaw tightened. Safe enough. Ryan's eyes drifted, trying to understand the room. He inhaled, then winced, and his hand twitched as if he wanted to sit up, but could not. Who? Ryan whispered. Who did it? The chest. Caldwell paused. He glanced toward the glass, briefly toward where Maya stood outside, like a shadow that refused to be noticed. He looked back down at Ryan. A nurse. Her name is Maya Grant. Ryan blinked again, eyes searching his memory. Medic. Caldwell's voice softened, almost imperceptibly. Yes. Ryan's throat moved with effort. Tell her. Thanks. Caldwell nodded once. I will. Kim adjusted a monitor setting, then guided Caldwell toward the door. We need to keep stimulation low. He is stable, but he is fragile. Caldwell stepped back out into the hall. When his eyes met Maya's, the expression on his face had changed. Not softened exactly, but shaped by something more human than command. He asked for you, Caldwell said quietly. Maya held his gaze. He does not know me. Caldwell's voice remained calm. He knows hands. He knows the feeling of being pulled back. Maya swallowed the motion tight in her throat. Tell him to rest. Caldwell nodded. Reddick's lawyer appeared in the hall again, face-drawn phone pressed to his ear. He ended the call when he saw the police. This is not appropriate, the lawyer said to Alvarez. We have internal processes. We can handle staff conduct. Alvarez's tone stayed even. Assault is not staff conduct. It is assault. Reddick's voice cut in sharp. I did not assault anyone. Denise looked at him. You hit her. Reddick's eyes flashed. I disciplined her for cutting into a patient. Alvarez's gaze moved to Maya's face again, then to the bruise. Ma'am, do you want to file a report? Maya hesitated. The question was simple, but nothing about this morning felt simple. She looked at Alvarez. I want the hospital safe. Alvarez nodded once, acknowledging her priority. We can do both. Caldwell's voice entered quiet, but firm. You will file the report. Your statement matters. Reddick turned toward Caldwell. This is coercion. Caldwell's eyes stayed cold. This is accountability. Maya exhaled slowly. She nodded once to Alvarez. Yes. I will give a statement. Alvarez motioned to an officer down the hall. Get a quiet room. Bring witnesses from Trauma 1. Secure footage. Reddick's face tightened with panic. You cannot pull my staff away? We have patience. Denise's voice stayed steady. We have patience because staff show up anyway. Even after you hit them. Reddick's jaw clenched. He looked around the ICU, at the guards, at the police, at Hazmat, and finally at Maya. The anger in his eyes dimmed, replaced by the look of a man realizing the story had left his control. Maya followed an officer into a small consultation room near the unit walls, painted a calming color that did not work. A table sat in the center with 2 chairs, a box of tissues, a laminated poster about hand hygiene. The room smelled faintly of stale coffee and disinfectant. Alvarez entered with a tablet. Tell me what happened from the moment you arrived on shift. Maya began. She kept it factual. Times, actions, words. The gurney at 7:42, the surgeon delayed, the monitor stuttering, her decision, the slap, the firing, the helicopter, the intercom, the supply wing, the vial, the basement. Evan Cross's hand on the override, the struggle, the fans stopping. Alvarez's eyes narrowed at the name. Evan Cross. Maya kept her face still. That is what he called himself. That is what I knew him as. Alvarez tapped notes, then looked up. Do you have proof of prior connection? Maya's mouth went dry. Not in this hospital. Alvarez nodded slowly. We will work with federal partners. We will confirm identity. Maya did not correct him. Confirmation was his job. She had done hers. When she finished, Alvarez leaned back slightly. You are injured. Maya glanced down. The scrape on her wrist had bled through the gauze Denise had pressed into her hand. It is minor. Alvarez's gaze held steady. It does not look minor. Maya did not respond. She was listening to the hospital through the wall. The overhead pages, the distant alarms, the low rhythm of beeping machines that never cared about police statements. Outside the consultation room, voices rose and fell as hazmat coordinated sampling and staff moved through controlled routes. The hospital continued. It always continued. Denise slipped into the room quietly near the end, as if she had been allowed to, as if she belonged in any space, because she carried the building on her shoulders. Alvarez stood. I will need witness statements. We will follow up. Do not leave the facility yet. Maya nodded. When Alvarez left, Denise stayed closing the door behind her. For a moment, they stood in silence. Denise looked at Maya's face, then at her wrist, then at the way she held herself like she was bracing for another hit. You are not okay, Denise said. Maya's voice was quiet. I am functional, Denise exhaled. That is not the same. Maya looked down at her hands. The memory of Evan's calm smile in the control room sat behind her eyes like a stain. Denise's voice softened slightly. Why did you not tell anyone you had been in something like this? Maya's jaw tightened. Because people ask questions. Denise leaned against the table, arms crossed. I am asking questions. Maya met her gaze. If I say it out loud, it becomes real again. Denise held the look, then nodded once, as if she understood more than she wanted to. Reddick is not coming back onto the floor, Denise said. Maya's expression did not change. Is he being arrested? Denise's mouth tightened. The police are talking to him. The board is being called. His lawyer is yelling. That is all I know. Maya looked at the hand hygiene poster, eyes unfocused. He hit me like it was nothing. Denise's voice sharpened. It was not nothing. Maya's throat tightened again. She blinked hard, then steadied. People are still sick. Denise nodded. Bed 12 is stable on the vent. Staff exposures are being monitored. Hazmat is pulling samples. They are shutting down the supply wing and checking duct access. Maya's ribs ached as she shifted. She pressed her fingers lightly against the bruise as if she could hold it in place. Denise watched the motion. You need to go to employee health. Maya's eyes flicked up. I am not an employee. Denise stared at her. You are a nurse in this building, whether administration likes it or not. Maya hesitated. Denise's voice softened again, but the firmness did not leave. Let someone look at your ribs. Then you can decide what you are doing. Maya nodded once, not agreeing so much as acknowledging reality. Employee health was 2 floors down, tucked behind a corridor that smelled like bleach and bureaucracy. A nurse practitioner took one look at Maya's face and wrist and asked questions with a careful voice. Maya answered with as few words as possible. The practitioner palpated Maya's ribs, and Maya's breath caught despite her control. Bruised, the practitioner said. Possible hairline fracture. We can do imaging. Maya shook her head. Not now. The practitioner's eyes narrowed. You took a hit to the chest, and you were in a possible chemical exposure. You need evaluation. Maya held her gaze. I was masked. I am not dizzy. I am not short of breath. The practitioner exhaled. At least let me wrap your wrist and document injuries. You need documentation. Maya did not argue. Documentation was a language the system understood, even when it did not understand people. When she returned to the ICU, the hallway had changed again. The initial chaos had settled into organized tension. Hazmat staff moved between rooms taking swabs and air samples. Police officers stood at corridor junctions redirecting visitors asking questions quietly. The intercom remained silent as if the building had decided to stop trusting its own voice. Caldwell stood near the ICU desk, speaking to Sergeant Alvarez in low, clipped sentences. His officers remained near Ryan's room. Reddick was not visible. Kim caught sight of Maya and walked toward her, eyes soft. He stabilized, Kim said. Bed 12. The vent is doing the work. His blood gases improved after the airflow stopped. Maya nodded, relief tightening in her chest. Good. Kim hesitated. Lieutenant Caldwell is asking again. He is more awake now. He keeps saying he wants to see you. Maya's first instinct was refusal. Not because she did not care, but because care created ties, and ties created leverage. And leverage was exactly what Evan had come for. Caldwell looked up and met her eyes as if he had heard the exchange. He is lucid enough, Caldwell said. 1 minute. No strain. Maya held his gaze. I do not want a ceremony. Caldwell's expression remained calm. Neither do I. Kim opened the door. Maya stepped into Ryan's room, and the air felt different. Warmer, quieter, sealed off from the ICU's watchful tension. Ryan lay propped, slightly eyes open now, face pale, but alive. His voice was rough. You, he said, as if the word contained everything he needed. Maya stood near the foot of the bed, careful not to crowd him. Rest, she said. Ryan's mouth twitched. I tried. They keep hovering. Maya glanced at Kim, then back at Ryan. You were shot. Hovering happens. Ryan's eyes narrowed slightly, trying to focus. My uncle said your name. Maya kept her voice even. That is not important. Ryan swallowed. It is to me. I felt hands. I thought I was done. Then I came back. Maya's ribs ached as she inhaled. You came back because your heart kept beating. Ryan's gaze held hers. No. I came back because someone did not wait. Maya did not respond. She refused to turn the moment into something sentimental. Sentiment was for rooms without alarms. Ryan's eyes drifted to her cheek, the bruise visible even under the harsh light. His expression tightened. Did they do that? He asked. Maya's voice stayed flat. It happened. Ryan's jaw clenched. That is not acceptable. Maya's eyes narrowed. Focus on breathing. Ryan exhaled, then nodded once, obeying because he was trained to follow direct orders when they saved energy. Thank you, he said again, quieter now, for not letting me die on a hospital table. Maya held his gaze for a moment, then gave him the smallest nod. Do not make me do it twice, she said. Ryan's mouth curved a weak smile. Deal. Kim touched Maya's arm lightly. That is enough. Maya stepped back and left the room. Outside, Caldwell waited. He did not ask what Ryan said. He studied Maya's face instead, the bruise, the tightness around her eyes, the way her shoulders held tension like armor. You have injuries, Caldwell said. Maya kept her voice steady. I was checked. Caldwell nodded once. Good. They stood in the ICU corridor as staff moved around them. Hazmat equipment clicked. A police radio crackled. A nurse pushed a med cart with hands that trembled slightly. Caldwell's voice lowered. The suspect spoke your name over a hospital intercom. Maya's throat tightened. Yes. Caldwell held her gaze. You do not want protection. Maya's eyes sharpened. I do not want ownership. Caldwell's expression did not change. Then do not accept ownership. Accept support. Maya exhaled slowly. The word support felt dangerous, but it also felt like the truth of why she had not walked out of the lobby when she had the chance. Denise approached, eyes sharp. Trauma just called. 2 incoming from a freeway collision. They are short-staffed because people are pulled into statements and exposure checks. Maya's body responded before her mind did. Her hands flexed ready. Denise watched her. Do not. Maya met her gaze. People are bleeding. Denise's jaw tightened. You are injured and you are not on the schedule. Maya's voice stayed calm. I am on the building. Denise held her gaze, then nodded once, almost imperceptibly. Caldwell watched the exchange. You are going back down there. Maya nodded. That is where I belong. Caldwell's eyes stayed steady. You said you wanted distance. Maya's voice was quiet. Distance from speeches, not from work. Denise walked with Maya toward the elevators. Caldwell followed 2 steps behind, not crowding, simply present. The ICU doors slid shut behind them with a soft hiss, and the elevator ride down felt longer than it should. On the emergency floor, the familiar chaos met them like a wave. The sound of a trauma page, the squeak of gurney wheels, a family arguing softly near a curtain, a nurse calling for blood. the smell of antiseptic and sweat. Denise stepped into motion, immediately giving orders with her usual clarity. Bay 2, get airway ready. Call radiology. Somebody find me an extra set of hands. Maya moved toward the supply cabinet, then paused when she remembered the supply wing was sealed. She pivoted instead, grabbing gloves and gauze from a bin, then stepping into Bay 2 as the gurney arrived. A young woman lay on it, eyes wide blood at her hairline. A man beside her groaned, one arm bent at an unnatural angle. The paramedic spoke fast. 2-vehicle collision. Airbags deployed. Possible internal injuries. Hypotensive on scene. Maya placed her hands on the woman's shoulder, voice low. Look at me. Tell me your name. The woman blinked through fear. Jenna. Maya nodded. Jenna, you are in a hospital. We are going to help you breathe, and we are going to stop the bleeding. Stay with me. The monitor beeped. The numbers did what numbers always did, indifferent to helicopters and admirals and intercom threats. They only cared about physiology. Denise stepped in. Maya, pressure on the abdomen. Patel, ultrasound. Dr. Patel appeared, eyes tired, but focused, and for a second, Maya saw the earlier fear replaced by the familiar urgency of medicine. Maya pressed down gently, reading the resistance feeling for rigidity guarding. Jenna flinched and gasped. Hurts, Jenna whispered. I know, Maya said. Keep your eyes on me. Caldwell stood at the trauma bay doorway for a moment, watching without interrupting. His uniform looked out of place here among scrubs and blood and frantic competence, but he did not bring drama into the room. He simply observed, as if confirming something about Maya that he already knew. Reddick appeared briefly at the end of the corridor, flanked by police, face-tight hands held low, as if he had been told to keep them visible. He saw Maya in the bay and looked away quickly, like the sight burned. Alvarez walked him past without stopping. Maya did not follow them with her eyes. She did not have room in her head for him now. Jenna's breathing was shallow. Her pressure was dropping. The team moved fast. Denise called for blood products. Patel confirmed fluid in the abdomen. Larkin arrived and took over airway decisions. Maya stayed with Jenna, voice steady, hands precise, anchoring a terrified person in the only way that mattered. Minutes later, the gurney rolled out toward imaging, and the bay breathed again briefly. Maya stepped back, peeled off gloves, and noticed her hands were steady now. Not because the day had become easier, but because this was the part that made sense. Denise leaned close. You need to sit. Maya shook her head. Next patient. Denise's eyes narrowed, then softened slightly. You are impossible. Maya's mouth twitched, not quite a smile. So are Mondays. Denise huffed a quiet laugh that sounded more like relief than humor. Caldwell remained at the end of the bay, watching the emergency department move like a machine that refused to stop even after someone tried to poison its air. When Maya finally looked up, their eyes met. Caldwell's voice was low, meant only for her. You came back into the noise. Maya wiped her hands, then reached for another pair of gloves as another nurse called for help at Bay 3. I never left it, she said. Caldwell held the look for a second longer, then nodded once the gesture small but final. Maya turned toward Bay 3, toward the beeping monitors and the shouted vitals and the frightened eyes of strangers who did not know how close the hospital had come to becoming a box. Outside Tacoma, rain kept falling. Inside, the work continued. If you are still here, like the video and comment the city you are watching from.